Center, ready for the regular City Commission meeting. So, Madam Clerk, do we have a quorum?
Yes, Mayor.
Okay, it's Commissioner Euler's turn to do the Pledge of Allegiance and the invocation.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please bow. Heavenly Father, today is an important day. Please be with those who are working the election polls and our first responders to keep them safe. Be with each one of us as we learn the outcome of the election, to remember that we are one nation under God. Lord, we ask for your presence today in our commission meeting. May you give each one of us the wisdom, knowledge, understanding, and peace to guide us towards making a decision that is for the good of all. Lord, we ask these things in your name. Amen.
Amen.
Amen. So you have, I know you've had a chance to review the minutes of the last regular meeting. If there are no corrections or no additions or corrections, they shall stand as approved.
Fine.
Okay. And again, remember, you'll need to speak clearly and slowly, sometimes especially with the mask, so that people can hear you. And I know my voice is echoing very loudly. So today we have a lot of people who are coming here for public comment. So I'm checking in with the City Commission. We would like to have an opportunity for each person to speak, to be able to make sure that they can say what they'd like to say. We do have two rooms of people, so as you speak, if you will go to the other room, if you want to continue to be at the commission meeting, you sure can, but that would be free up a chair for someone else to come in and speak at the podium also. Also, we will start, again, customarily we do 5 minutes, but again, we're going to give you as much time, but we just ask, again, be judicious and make sure you're sharing the talking time and helping others so that we can make sure we have that. Today, we'll start with Andy Flimmer from St. Catherine's Hospital, followed by Dr. Burns. And then we will go ahead and hear from those two. And then after that, however people would like to speak, come up and speak, we can do that.
Actually, Mayor?
Yes?
I would request that maybe I go last. Would that be okay?
Nope, that's no problem at all. Okay, that works. Mr. Flimmer, thank you for coming today.
Well, thank you for having me here. I'm Andy Flimmer. I'm the interim CEO for St. Catherine and Bob Wilson Memorial Hospital. I've been here since August 3rd. I was originally the COO at Mercy Hospital, a Centura facility in Durango, Colorado.
Well, welcome to Garden City.
That's right, yeah.
This is a very welcoming town.
Oh, good.
Good.
We would love you to stay if that you're so inclined, so yeah.
Well, thank you. So this is a very nice town. I didn't know what to expect when I was doing the 8-hour drive over.
Right.
And this area has its own beauty. You can see for miles. I do like that. I have a home my wife and I have a home in Phoenix, Arizona, in Sun City Grand, which is in Surprise, if you're familiar with the area. So I just wanted to come before the commission. I did speak to the commission yesterday for the county, just to give an update on the COVID status at St. Catherine Hospital, which is the sole community provider and hospital, the only ICU for hours around. We have 8 beds. They have typically been all full, mostly with COVID patients, but we're also taking care of everybody else. And that's our mission and our responsibility as a regional referral center. We have patients that are in our hospital due to stroke, heart attack, you name it, motor vehicle accident, gastrointestinal issues, any and everything. We can handle a lot. We try not to transfer out when we can. So I just wanted you all to know that is our mission. Unfortunately, well, let me back up a little bit. All of the Centura facilities have had a mask mandate in all of our facilities since the beginning of COVID back in February. We have paid screeners now at our entrances. We have infrared thermo temperature scanners at the entrances. If you've been to the hospital, you have seen that. We have closed some of our entrances down to make the entrance into the facility safer and the ability to staff it and have screeners at those entrances. So we're like an island. It's actually very safe inside the hospital building. We also have some technology that, it's a robot that emits UVC light that kills the virus. Those go in every room after patient discharge and in many of our meeting rooms and also in other places in the facility. In addition, our housekeeping staff wipes down all surfaces at least 4 times a day and disinfects and takes care of that. We have an amazing group of physicians, APPs or mid-levels, and nurses and other staff at St. Catherine Hospital. I know this town is proud of its hospital, and you should be. It's a very good hospital, and again, we're the sole community provider, the highest level of care, until you get to Wichita or Colorado Springs or Denver. Unfortunately, when my staff walks outside of the building, they're walking into an environment in Finney County and Garden City where there is no mask requirement, or it's not even encouraged in a very public, visible way. I'm very proud to see you all wearing your masks during this meeting. We wear masks and socially distance in all of our meetings in the hospital. So I'm concerned about our hospital because I have almost 40 associates out due to COVID now. And most of them have had it through being community acquired, not in the hospital. So they're not getting sick from working because they're wearing masks, and if they're in a patient room, they're wearing PAPRs or N95 masks, gowns, and gloves. So it's actually safer for them to be in the hospital than to be out in the community. And I am working on setting up a task force that'll be led by Live Well, Finney County Health Coalition, Callie Dyer, Beth Coxell, and we're going to pull together a number of agencies, the city, county, health department, some other organizations in town, the school district, and we're going to work on very quickly getting a massive awareness campaign out into the community. We haven't decided on the messaging. It may be something along the lines of the 3 W's, which you may have heard of, which is wear a mask, wash your hands, and watch your distance. Something simple and catchy that everyone can put to their memory and start saying it and putting it all over town in banners, LED signs, wherever we can get that information posted and get that awareness out there. We have got to get more people wearing masks. I'm not asking for a mandate. Want to make that clear, but definitely want to at least encourage the 3 W's because those 3 together are proven public health mitigation strategies that are working. You may be familiar with a University of Kansas study that was recently published. Shows that in counties where mask mandates are in place or encouraged, it's a 50% reduction in the spread compared to areas where masks are not encouraged or mandated. And I have copies of that study too, and I think Dr. Svati is also going to speak to that as well. And so I just wanted to also let you know our behavioral health unit has been closed. Barbara Willis is our chief nursing officer, and Michael Groh is our infection prevention manager. They've both been really busy and trying to keep the hospital safe and staffed. Yeah, it's been a few months. We're the only behavioral health, inpatient behavioral health unit until you get to Wichita. And that saddens us that we had to close it, but it was due to COVID, staffing, and all of these stressors that we're seeing at the hospital. When COVID first started, we didn't have a staffing issue. Now we do, and it's getting worse. We even have some providers that are out due to COVID now, and that's very concerning. We need to be able to take care of our community and anybody that walks in our doors. They'll definitely be safe and they'll feel safe, but we're getting at a critical point at our hospital with so many associates out due to COVID acquired in the community. So I just wanted to just give you an update. The hospital is back to full operations, has been for many months. We're probably at about 80–90% of historical volumes compared to last year. And we're doing okay financially, and so is Centura. Centura, being part of a health system like Centura, has been very, very beneficial for this community and for St. Catherine and Bob Wilson. Centura has taken great care of us. They have never let us run out of supplies, never let us run out of remdesivir. They've actually pre-positioned it out here in Garden City, so we have it when we need it. We just have to wait on the state approval process, which is actually very quick, fortunately. We only have 2 hospitalists currently at St. Catherine. We are expanding that to 4, and we have some great candidates that we've been interviewing and we'll be extending offers to shortly. This is a growing community, and our hospital numbers have been growing pre-COVID, and they're rebounding back now. But I just wanted you all to know Centura is investing heavily in St. Catherine and Bob Wilson, in the people, adding more providers and mid-levels, APPs, and staff and technology. And that is not the norm across the country. Many health systems are struggling financially. Centura is so well run that it is actually seeing a surplus, which all of that gets reinvested back in when we're a not-for-profit organization. So we don't have shareholders to pay. So we have stakeholders. And you all are some of our very important stakeholders. So do you have any questions for me?
Questions? I have a couple, but do you have any questions?
If we are full with our ICU and we have our 9th patient come in, what is the procedure to treat that 9th person that would need that facility?
So we're constantly looking at what patients can be discharged from the ICU or transferred down to a lower level of care. We due to staffing, normally if we were at a higher level of staffing, we could set up some additional ICU beds. We do have additional ventilators. The issue, critical missing ingredient, is qualified ICU nurses. We've had nurses in from Colorado, from Centura, another way they've helped us out, and hospitalist physicians and hospitalist APPs. We'd have to transfer them. And some of these transfers are getting pretty far out. I know Goodland had to send someone to Amarillo. That's a long ways away. Wichita, I just learned from Dr. Burns, the Wichita ICUs are full right now. But as you all may know, that can change in a moment's notice when a patient could be transferred to a lower level of care on the medical unit or to home health care or to a long-term facility. So it's been very challenging. Barbara, did you want to add anything?
And you can use this mic, Barbara, here if you want to. That way we can hear and everyone else can. Thank you for coming today.
Sure, no problem. Yeah, we do everything we can not to transfer that patient because we want it to be easier for the family to be able to see them. But at some point when the ICU is full or we don't have the staff to take care of them, it's safer for the patient to go. We have kept them in the ER for a couple hours if we knew someone was going to be moving out of the ICU so that we can get them in, because we know it's a hardship on the family when we have to ship them, especially as far as Amarillo or Oklahoma City or something.
Thank you.
Thank you.
And Barbara, you're originally from Oklahoma, correct?
Yeah.
So Barbara's purchased a home and her family's here.
Oh, good.
She started in June.
We're glad you're here.
We're very fortunate to have somebody of her caliber and experience as our chief nursing officer, our chief clinical officer.
Welcome to Garden City. Any other questions? I do have a question. And so as far as, I mean, I know that we're, the Tri-City region with Dodge City and Liberal, we're all interconnected. I know we travel between the cities.
Right.
And I'm not asking you to answer as far as numbers for them. I mean, but do you know what's going on in their hospitals and how that's happening? I know you work closely together, which I appreciate, but I'm curious about.
So I will actually know more. The Kansas Hospital Association just set up a biweekly call for the western part of the state. And we're going to try to participate. I'll try to be on that call. So we'll learn more I do have a relationship with the CEO at Liberal, and he's from this area, this region. So that's, and we do talk, but they tend to transfer to us versus the other way around. Sometimes we've transferred to them if they have a bed open, or the patient's from that area, and that hospital can take care of the patient's needs. But they're stressed like we are. We're all struggling to find and keep staff. We've submitted a proposal to Centura to help mitigate the loss of staff, and it's not just dollars. We also have implemented nurse-to-patient ratios, because that's one of the key dissatisfiers for any nurse is how many patients they're actually taking care of. And it does matter about the acuity of the patient, whether they're COVID positive or not, and that sort of thing affects the ratios. But Barb's been doing a great job of helping to enforce those ratios. But nurses, by their calling, want to take care of patients, and they will do anything they can to make sure those patients are taken care of. And so that we've got an awesome nursing staff here. We have a really strong nurse training and education program at Garden City Community College. They produce fantastic hospital bedside nurses through their 2-year degree program. So did that answer your question?
Yes, and any other questions?
I just have one. Do you contract out with traveling nursing programs to bring in staff to help facilitate, or to help
We do.
with that? Okay.
We do. We try not to because they're about 3 times the cost on an hourly basis. Also, you commit to a long-term 13-week contract, and Barbara knows way more about this than I do.
Yeah, actually, we're trying to get 6 med-surg nurses and 2 ICU nurse contracts. The problem is everybody in the country wants travelers.
Sure.
So we're having a hard time finding them, but we are actively recruiting for that, for travelers for those positions.
Okay.
And I know this isn't Garden City specific, but Bob Wilson successfully has 2 OB traveler nurses that are, one has started and another will start soon. We've had to close that OB program, which is a hardship on anybody that depends on that within the region.
Well, I just want to say thank you for the update, Mr. Flimmer. We know that you're a large employer in Garden City. You're very important in our healthcare. Like you said, you are the regional hospital, and so we would invite you back anytime that you feel there's something that you need to speak before the commission. Please don't make it to be something that you have to have a special invitation. We just want to make sure you can come back anytime.
I appreciate that, and you all have a very beautiful city with beautiful, welcoming people.
Great.
I've lived all over the country, and not every place is welcoming, surprisingly. So I just wanted to share that with you all. And I'm here for the duration until a permanent CEO is selected. Some of my assignments have lasted 2 years. I was the interim Chief Administrative Officer at Mercy in Portland, Maine. So I'm here open-ended until the right person is found, the right fit with them and their family. And Centura is making sure that that's going to happen. So again, appreciate the audience and appreciate meeting you all.
Yeah, welcome to our
Yeah,
community.
thank you.
Thank you.
Thank you. So again, I know that you come to the mic, and when you come to the mic, if you'll please state your name. Mr. Flimmer was listed as a public comment, but if you'll state your name, and again, we want to make sure that you have plenty of time to speak. If you have questions for the speakers, if you'll record those, commissioners, and then again, in the interest of time, if we want to call back or ask questions, I think it would be better to wait until after everyone is spoken. If you cannot stay, then we will make sure and record the questions, and then we will send those out to you. But so again, we just invite you to the mic if you will state your name, and then that way we can get started.
Not everybody jump at once.
Hi, I'm Dr. Gretchen Dunford, community member.
Good afternoon.
surgeon. As most of you probably know, there's quite a few of us here today that attended the county commission meeting yesterday. Frankly, I was pretty proud of us because the last thing I expected was a motion. So I would say that that's progress. I do kind of want to fill you in though on how things went yesterday. My colleagues and I were patronized and subjected to biased anecdotal information from a commissioner who has never cared for a patient and also made remarks that are frankly inaccurate. Masks do not result in decreased oxygenation. I'm a surgeon. I wear one for hours at a time, and I hope for everybody's sake that I'm not lacking oxygen while I'm operating. Vitamin D deficiency is extremely common in the United States, so much so that primary care physicians often recommend supplementing it daily. That's been a recommendation for years. It has nothing to do with susceptibility or recovery from COVID. The fact that the board chairman allowed this person to pontificate giving medical advice and recommendations which are non-evidence-based is at best completely irresponsible and verges on dangerous. Also, my colleague and I were called argumentative by another when he asked us a question that was really just answered by an example of a city mask mandate that we were referencing. We as physicians and public health officers are obligated to do no harm and to follow recommendations and guidelines. And in the midst of these unprecedented times, it's even more important. There are ever-evolving presentations and comorbidities associated with this virus, as well as management strategies. No physician would give advice on any other disease process without following guidelines. No patient would want their breast or colon cancer managed without their care team following NCCN guidelines. Mask wearing in public is a CDC recommendation. We were told by county commissioners yesterday that they didn't trust the numbers that were presented by the health department. I would ask, what isn't there to trust? A positive test is a positive test. And nitpicking at the health department's numbers, however they want to do it, doesn't fix the fact that we have had around a third of our total positive cases occur in the last 30 days. Yesterday, only one of 4 county commissioners provided any reasonable response to this problem that we were coming to them about. They knew that we were going to be there to ask for help and still failed to prepare in any way other than what continues to support their political narrative. The only public comment in opposition to the numerous community members asking for help was an individual who was trying to pass herself off as a frontline worker, when the truth is that her passion are activities surrounding county partisan politics. At this point, I have to resolve myself to the fact that people have the information. I, as well as my colleagues, have gone on public record. If our local government continues to do nothing, I fear that this public health emergency will continue to strain our local facilities to the point where patients may not get care. You heard from the hospital CEO about how strained it already is, including the lack of inpatient behavioral health services, which now, and this has been a point of contention for a lot of years, fearing losing that because it's we're the only one between Larned and the Denver, Colorado Springs metro area. I also fear for many people I know who do run small businesses, many of them going into their busy season, that they'll be affected if disease rates continue to climb. I gave to your clerk a couple of city ordinances. One is from Hays, Kansas. The other is from Salina, Kansas. Both of these cities, city commissions passed these ordinances when their county would not. So I'm asking you to follow this example and pass and enforce a city mask mandate, as the county leaders are clearly not willing to do this. Thank you. Do you have any questions for me?
No, thank you. Very nice. Thank you.
Hi, Commissioners. Thanks for having us today. My name is Dr. Rachel Swati. I'm a family medicine physician at Plaza Medical Center here in Garden City. I'm here today, as many of these individuals are here today, to discuss with you the state of COVID-19 in our community and the dire need for more measures, and I truly think specifically at least a citywide mask mandate to help slow the spread of COVID-19. I'm also here today because as a physician and as a Christian who believes that each and every life is important, I love and care about the people of this community and their well-being. In the past month, we have seen our case numbers in Finney County, based on the health department's website, increase dramatically from 2,169 cases on September 30th to 3,105 cases on October 30th, which is an increase of 936 cases in the past month. It means, as Dr. Dunford said, that 30% of the cases that we have had for the entire pandemic in this county have occurred in the month of October. On October 30th, we also had 653 active cases, up from 197 on September 30th, a more than 3 times increase. We've had 20 deaths in this county since the beginning of the pandemic, and 8 of those have occurred in the past month. What is even more troubling is that on many occasions, as you've already heard, our hospital ICU has been full in the past few weeks. Unfortunately, as you've also heard, our hospital is not alone in this. In the past couple weeks, ICUs across the state, including those in Hays, Liberal, Wichita, which news reported is completely full as of yesterday, and Kansas City have been full or near full. As COVID-19 case numbers increase, we typically expect hospitalizations to also increase even further 1 to 2 weeks later. Hospital systems in some other states, such as Utah, have already begun to create criteria on how to ration care in the scenario that they do not have enough hospital or ICU beds available. Kansas does not appear to be far behind these locations in our numbers. I don't know about you, but the thought of any doctor having to decide who receives care and who does not receive care makes me sick to my stomach. Doctors, nurses, and respiratory therapists and healthcare workers across the board are doing everything they can to provide the best possible care to their patients. But the fact of the matter is that there are just not enough of us to keep up with these case rates. In light of this, as a community, we have got to do more to help. The recent KU study that was referenced was from October 25th, and you should have a copy of that. It looks at rates of COVID-19 cases in Kansas counties that have adopted the governor's mask mandate on July 3rd versus those who did not. It actually does not look at whether or not counties encourage them or not. Counties with a mask mandate showed a decrease in cases 14 days after the mandate was placed. Case rates in counties with a mask mandate have held steady, while those who have not had a mandate have continued to steadily increase. Overall, it was showed that counties with a mask mandate have a 50% reduction in spread. Keep in mind that this data is truly Kansas data. This is about us and shows us that mask mandates do help. You may point out that we are currently addressing you, the city government, and not the county. There are multiple cities across the state who have created mask mandates either prior to or without the county creating a mask mandate. It can be done, and it would be beneficial. In addition to the minimum of creating a citywide mask mandate, I think we also likely need a limitation in the size of social and other gatherings in the coming weeks in our community. Yesterday, as you've heard, that we were there at the county commission meeting, the county commissioners spent much of their time debating the accuracy of the positivity rate in Finney County and whether it could be compared to other counties such as Sedgwick or Johnson counties. While positivity rates are important data to track, I would suggest to you that what really matters even more than the positivity rate is the fact that our hospital is so heavily burdened and has been full on many occasions in the last few weeks. If our hospital is full and hospitals that we transfer to are full, where will our patients receive care? I will close with this. Today I have with me a third-year KU medical student, just back here in the corner. She's been shadowing me for the past few weeks. Hopefully I've been teaching her well. She's a local girl who hopes to potentially return to Garden City to practice medicine, which is something that I think we all ought to be pretty excited about in a community that is always in need of more physicians. By the time she's ready to do that, she will have completed 7 years of medical education and training, just like I have, just like Dr. Dunford has, just like Dr. Burns has. She also attended the county commission meeting with us yesterday. I don't know if she's a glutton for punishment because she came back again today. But at that meeting, what she saw was commissioners there listen to multiple community leaders and healthcare providers plead for help, and yet ultimately they decided to do nothing. It had previously been my understanding that elected officials look to experts in their field for advice and knowledge when making decisions. After that meeting yesterday, as well as with many experiences in the past several months related to this pandemic, I've begun to seriously question whether that's truly the case. So here's my question for you guys. What will you do? Will you, as local officials, once again ignore statements from your local physicians, school board superintendent, hospital CEO, and others? Or will you hear what we have taken time out of our day to come tell you and take action? Will you show my student, a potential future physician for this community, that her education matters? That in 5 years from now, if she's here caring for patients in this community, that her local elected officials will hear her voice when she comes to them. We are here today asking for your help. We need your help. How will you respond? What will you do? Thank you.
Good afternoon, Mr. Mayor.
Good afternoon. Welcome.
Commission. I have a handout packet here. Okay. For the record, my name is Jim Carlson. I'm coming before the commission today as the managing partner of Stillwater Technical Solutions. And in my capacity, Stillwater Technical Solutions is a nonpartisan, for-profit public policy advisory firm that specializes in federal and local government administrative procedures, natural resource policy making, administrative complaints, local government relations, litigation spotting and management, and intergovernmental advocacy. I know that's a mouthful, but what I'm going to do is I'm going to use that as a platform to share with you some of the policy issues. I'm going to bring before you a few policy issues. I'll try and stay within the 5-minute limit. I might go over just a little bit if there's questions.
That's fine.
But I want to draw your attention first to, in the packet before you, my release as of 10/26/2020. I was released. I had COVID. And I was down for literally 18 days, not able to move. I was released last Monday. And what brought me to the medical establishment and healthcare was it started moving into my respiratory system. And so I had phone calls coming from my colleagues and my associates, people that work for me, saying, Jim, you got to get in. And my wife, she just keeps looking at me and saying, you know what, you'll be okay. And I wasn't going to be okay. So I went in and sought medical attention, and I was one of those ones that can attest to how awful this thing is. So with that said, now having said that, there are more considerations than, and I'm going to bring before you a different perspective. Dr. Spotty said that we need to have informed policy, and I agree with that. And what that means is that we don't just let one sector of professionals bring forward a narrative. And so I'm going to bring before you a different narrative, and I use my COVID, my COVID hit, I'll call it that, to say that I'm not insensitive to this. But I am going to share some difficult things, and that with regard to government policy. And that is, so my purpose before the commission today is offer a balancing and dissenting opinion. So I'm going to bring before you a dissent. It's very respectful for your positions as policymakers and commissioners. And I'm going to bring before you a dissent to the petition by Dr. Lindsey Burns that requests this commission to mandate face coverings. And I have no doubt in the sincerity, and I have no doubt that Dr. Burns believes that the governmental order from this commission, would be beneficial to the community. I think that there's a genuine perspective out there. I don't question that. But I also believe this petition brings with it broader and more foundational policy questions that are actually spilling out over America, and that policymakers need to actually look at the broader perspective. And so what I'm going to do is I'm going to just share with you something I'm working on, and that'll provide a platform. Right now, my company we're informing litigation in 4 states that has to do with elections and election policy. But as part of that, the governors of Michigan, the governors of Wisconsin and Pennsylvania, Minnesota, Washington are all issuing executive orders, and some of them have to do with health mandates. They're ordering things that the executive branch does not have the authority to do. And so that's the issue, is that irrespective of all the difficulty things that are facing us, this pandemic's real. We've had pandemics before. Mankind's experienced those before. And irrespective of all of that, we have conflicts that I believe this board needs to look at. First one, in a number of states, mask mandates are creating statutory conflicts with on-the-books statutes whose express intent is to outlaw coverings that would inhibit identification of bank robbers and thugs and radicals who smash innocent citizens' windows. So we're now having these conflicts that are coming up through the judicial system and in American jurisprudence that you have coverings in public, people are smashing windows and doing all of this stuff, and now they can't be spotted, and they're using that as a cover, and you have state statutes that speak to that. In the South, unfortunate example is the Ku Klux Klan, and the South made mask mandates there that said you can't wear them. And so you cannot wear masks in public because people can't see who you are when you're doing bad stuff. And so in Minnesota, there's a very real example right now that litigation is ongoing, and that's against the governor who put a mask mandate in polls. Of course, Minnesotans are going to the polls today, those that choose to exercise their electoral privilege in person. And it's creating conflicts because you have a Minnesota statute that says that you can't wear masks in public. So, but there's number 2 and number 3 on your packet. There's a jurisdictional fragmentation question that I want to bring to the commission's attention. And this is a very, very difficult, thorny question if you think through it. Yesterday, as was testified before, the Finney County, Kansas Board of County Commissioners voted down a similar petition that requested imposition of countywide mask mandates. We all know that. If the city of Garden City, a municipality within Finney County, elects to a mask mandate and to impose that in public, what you're going to do is fragment public policy, because you have a county now that says you don't have to have a mask. You got a municipality that says you do have to have a mask, and then there's still Holcomb out there. So you have this hybrid fragmentation of jurisdictions that the average citizen is going to look at and say, what do I do? And so some are going to choose to wear masks, and some are going to choose not to wear masks. And that's the reality, because we're not going to enforce it. So now the greater problem is this. This is the greater problem I think that I bring to the commission, is what are we telling our young people when our municipalities and our counties cannot get along and come together on policy issues? And so we're saying, well, we think you ought to wear masks, and we don't think you ought to wear masks. And so now what we're doing is we're offering our young people a platform from which they can choose to whether or not to follow the rule of law. That, I think, is more significant over the course of generations than what we're experiencing. So I bring that to your viewfinder. The next thing is if the petition for the Garden City Commission were to be adopted, I have a real concern of other laws and statutes and ordinances, how that may be viewed in the future. I've already addressed that. Sorry about that. I repeated okay.
That's fine.
I'll bring myself to the last, I'm sorry?
No, that's fine.
I'll bring myself to my last point, and all of this is substantiated. Our 4 policy papers will be available, and I'm certainly willing to ask questions, but this is a very difficult one. As a subject matter expert in many facets of government, I am a national expert in government. It is my professional opinion, and I say this respectfully, that Kansas municipalities have not been delegated the legislative authority to mandate face coverings beyond city-controlled buildings and properties. I simply don't believe you have the authority to do it. I simply don't believe you have the authority to do it. Now, the governor will say, yeah, oh, they've got the authority to do it, but you'll notice that politically, she's passing that down. And she's been operating off a 1973 law, and truth of the matter is there's litigation going on all across the country that's questioning the executive authorities, the executive governor's authorities to issue mandates. And I think as the litigate, because the wheels of justice turn slow, you're going to see all of this roll back. So I'm very sensitive to the health aspects, but there are policy aspects, there are jurisprudence aspects, there's all kinds of stuff to be considered. And so with that, I'm requesting you to not act on the petition or reject it outright for want of more information. So with that, I'll stand for questions or comments.
Any questions for Mr. Carlson? Thank you so much.
Thank
I
you.
appreciate it.
Sorry, your card, please.
Ready?
Yes,
Yeah.
I'm sorry, Dr. Carlson. Carlin, thank you for
Good
coming.
afternoon. I'm Steve Carlin. I'm superintendent of schools for USD 457 Garden City. Here to visit with you about our current status and this situation going on in our community right now. In response to the COVID-19 pandemic, this summer over 200 of our stakeholders participated in the development of our COVID-19 response plan. Our plan provided an option for students and parents to choose between an on-site version, a traditional version, and a remote online or blended type version. About 1,100 of our families, students, chose the blended or the online approach. That's about 15% of our students. Our goal through this has been to have students at school, in school, face-to-face, as normally as possible while taking the reasonable steps to keep students and staff safe. The on-site option of our plan has 7 levels of increasing restrictions, 1 through 6. I'll explain that in a minute. Level 1 is completely normal, like none of this ever happened. Level 5 is a hybrid approach where half of our students come to school every other day and the other half learn from home. Level 6 is fully remote, where all students stay home and learn remotely every day. Level 3.5 was added about a month ago in an effort to make sure that no matter what level that we were at through these increasing restrictions, that all students, staff, and visitors wore face masks. The district is pleased that due to efforts of dedicated staff, we've been able to conduct 9, and now we're in our 10th week of face-to-face school. It's taken every job in our district to make this happen. Whether you're a teacher, a bus driver, nutrition staff, an administrator, a nurse, custodian, and the many others that we have, everybody's job has changed. Everybody's had to do things differently in order to accommodate the circumstances that COVID has brought to us. Since the beginning of the year, masks have been required for all students, staff, and visitors. For the most part, within our schools, mask compliance has been very good. We also have things in our plan related to social distancing, good hygiene practices, and other strategies that I think have contributed to our successful start. We've worked closely with the Finney County Health Department, and through their disease investigation and contact tracing procedures, we believe our data and our evidence shows that transmission at school has been very minimal. Most of our cases have been originating outside of school. Again, I would take an opportunity to compliment the Finney County Health Department from our conversations early in March when this first began, to the development of the district's plan throughout the summer, to the ongoing monitoring and meeting that we do multiple times a week with them now. I believe some of our staff are even having daily communications with the Finney County Health Department. In the school district currently, we have 113 staff members and 87 students who have tested positive. We have approximately 1,285 total employees and about 7,300 students. We're grateful that the danger to students, both in terms of the number of students testing positive and that being low, and that young people seem to have a milder experience with the disease, We're very grateful for that. However, the impact on adults at school is becoming very concerning. And we need adults healthy and at school in order for the school system to provide the services that we provide. Not only teachers and paras, but all those people I mentioned before play an integral part of the services that we deliver to students. Because the majority of the cases have not originated at school, it would seem that the increasing cases are a function of spread in our community. I'm here today because that situation does not look at all like it did in late August or early September when we started school. The COVID numbers, the case numbers are rising to, and the doctors here shared some of the specifics of those numbers, but they're rising to concerning levels. A hallmark of our plan has been to use data and evidence to guide the decisions that we make, and we're very concerned by that. If the situation doesn't improve in our community, it will not be possible for us to keep students in school full-time face-to-face. If the spread in the community continues at the same rate or gets worse, the school district will move to a level 5 hybrid or a level 6 remote on November 9th. Let me share some of the data with you that we have been looking at on a daily and weekly basis to get where we're at today. As of 10/29, data from 457, from the Finney County Health Department, from KDHE, from Johns Hopkins University, and the US Census. 2.72% of the United States population is tested positive for COVID-19. 1.23% of Kansas residents have tested positive. 8.43% of Finney County residents have tested positive. And as of that date, 7.59% of USD 45 staff had tested positive. As of yesterday, November 2nd, that was the first day that the rate of USD 457 employees being positive for COVID met or exceeded the rate of Finney County. In the community, weekly numbers of new positive cases in our community have increased drastically over the last 4 weeks. From 137 new cases in a week to 156 to 201 to 289. The positivity rate of testing has fluctuated throughout the fall, but during the last 2 to 3 weeks has been increasing and moving toward levels that occurred last spring. Rates went from 17% to 23% to 31%, and the preliminary information we received last Friday showed 41% for the following week. Andy was here today and shared information about the hospital. We've been looking at that and we've been hearing the same thing for a number of weeks as we meet. The data shared with us has indicated that the ICU has been at or near capacity for at least 3 weeks, that the number of COVID patients in the local hospital has been increasing 4 out of the last 5 weeks, and that the number is approaching crisis levels. From the school district, 75 of the 104 positive cases we had as of the 29th occurred in the last 4 weeks. Substitute fill rates for employees who are unable to come to work in the last few weeks are consistently running between 35 and 55%. Although this is a trend occurring across the state and country, it's reaching the point in our district where we will not be able to continue to function. I have to be able to instruct and supervise kids with adults where it's not safe to have kids at school. I understand that this is a very difficult issue. I know there are strong and diverse opinions about COVID and its impact. However, this is a public health emergency. Please listen to the credible science about COVID and how to slow the spread in our community. Again, the district's goal is to keep our children in school face-to-face, but that will only be able to happen if we work together in this community. It's a time for leadership. Please take appropriate steps and do not let this reach crisis levels where it could require even more extreme measures. Thank you for your time.
Thank you, Dr. Carlin.
Good afternoon.
Good afternoon.
My name is Stephen Madgwick. I'm a professional engineer licensed with the state of Kansas. I'm a family man. I have 7 children. I'm a former Marine Corps officer. I was born in St. Catherine's Hospital and went around the world and came back. Do you guys remember ventilators? We need ventilators. In fact, I'll pay double for used ones from China. Or, how about this one? Don't buy masks, don't wear masks, save them for the healthcare professionals. Or another one from April, we're gonna lock down, unprecedented. We're gonna lock down, you can't leave your home, but only for 2 weeks. Only for 2 weeks. The best minds in the medical field in Kansas said 2 weeks. And on top of it, medicine is even political. You can't use medicine we've been using for 60 years or 200 years if you look at its derivatives. And I find it extremely perplexing that professionals could come to the podium and with straight face ask you for unprecedented measures. And it's like, pick your science week. It's pick your favorite epidemiologist, because they're saying it from both sides. Nobody's mentioned Sweden. Nobody's mentioned South Dakota. Those states didn't lock down. They didn't have these extreme measures that the former county commissioners before you have never implemented, and they lived through it. Do you guys remember 2009, 2010 being crazy like this year? That was the year of the swine flu. Do you remember the avian flu? We didn't have face masks. Everybody in this room has probably been exposed to it 1,000 times already. You know, I don't mean to pick on anybody, but if you touch your face masks a lot, it's not any good, you know? And I'm an engineer, and I think you got a 2.3 micron particle that's a virus, and we're advocating putting a covering over our face that in no way can filter 2.3 microns. And we're breathing the same air. We're not bottling the air and putting it out there. It's coming out of our lungs, and it's what the scientists call aerosolized virus. And it's not catching it, so I don't believe the masks are effective. And so you guys are making a decision today, should we implement this? And you might have your own personal feeling about this. And I would request that you not impose that upon your decision today. And one of the things I have is, I do believe that there is the O2 oxygen levels are depleted when you have the face mask on there. And we could measure that, and the ability to get that data out into the open is suppressed. If you're a professional doctor and you go against the CDC, you're going to lose your career. There's a lot of pressure to keep your mouth shut and go with the flow. And that's why I'm asking you guys to stand up and stand strong. It's going to feel like you're not doing anything, but you are. You're protecting us. And as a dad, that's what it feels like sometimes, is you're protecting. A couple of personal responsibilities. People can smoke 2 or 3 cigarette packs a day, but you're going to tell them they have to wear a face mask? It doesn't make sense. And another one, Mr. Carlson talked about the laws, which is the higher law. If I was carrying, and I'm not, if I was carrying a weapon now, because Kansas is a concealed carry, constitutional carry state, all right, I would not be allowed to wear face masks. And so are you going to start walking up to people saying, are you carrying a gun? I would not recommend that, okay? And it's not, there's a higher law already implemented in the state, and there's probably other scenarios. I think it's appropriate to see where we're going with this, because I don't think, from the examples I've given before, that it's going to stop with face masks. They're going to want more. And the same people that's advocating face masks today will come back, and they're going to actually ask you to do a forced vaccination mandate. I believe that's coming. And we'll see in 6 to 12 months if I'm right or not, okay? But again, if there was a big problem with South Dakota, or there was a big problem with Sweden, we would see 5% of their populations wiped out, and they would be the biggest fools on the news. and nobody's saying anything because magnitudinally, they're about the same numbers as everybody else. And so I'm just pleading with you as a dad and as a community member, as a longtime Garden City resident, please do not take people's freedom away from them. I want you to protect their freedom, and I'm asking that respectfully, and I appreciate what you guys do for our community, and I don't want any fighting or civil violence because of the decisions that's made here today or setting precedent for future decisions. It's a nice day outside, it's sunny. You can go get a sandwich at Flat Mountain Brewery. You can, nobody's dying in the streets. It does not require unprecedented actions on your part. Thank you for listening to me. I appreciate it. I'll leave the room because I want to keep room for everybody else unless there's any questions from you guys. All right.
Thank you so much. Thank you, Mr. Medrick.
Oh, go ahead.
Hello all, Colleen Drees, Finney County Health Department.
Good afternoon.
Hi, I'm here to, I believe my data has been pretty much shared at this point. It makes me very happy that we've gotten the word out of what the caseloads and everything look like because you've seen it here today. Everyone has come and told you the data as well. My end goal here today is to say, yes, we've had a rapid increase of cases. It is very concerning in our community. I've been concerned for the last month. We've seen rapid rises. I need your support, your collaboration, for us to put together a unified message of precautions to be put in place of how we can reduce the spread. Because frankly, what we're looking at with numbers, how everything is going, it's very alarming moving into holiday season, moving into flu season with the numbers that we're seeing currently. It is alarming. I have great concerns for our community, as we also heard from the hospital of the increased admissions and the limited availability of critical care units. Those pieces to our community are vital. I have concerns when we see the whole Southwest Kansas region all seeing alarming rises, looking at the increase in cases in Seward and also in Ford County. I'm here today to just make sure that you know as well that we are very concerned. We went to County Commission, of course, as you know, yesterday to ask for some alignments, some support in decreasing the spread. I need that support by your board as well. We've got to find some sort of measures to increase messaging, communication of proactive measures to decrease the spread. I'm also here and happy to answer any questions if you all have any questions for me, representative of the health department.
I do have some questions, but I want to give anyone else a chance to ask before. Does anyone have questions? So Colleen, I'm curious about I know that you've been asking for masks, and encouraging the wearing of them. So why is that message not penetrating the public, and why have you're not seeing the success that you were desiring in order that there not have to be a mandate or not have to be a requirement?
Sure, so I think a lot of that is just general compliance is lower than what we would like to see. Of course, with anything, it's uncomfortable to wear a mask, right? With time, the compliance is great, it's awesome, but when you feel uncomfortable, eventually you start to get relaxed, and then you go into stores and you're like, they're not wearing masks either, so, this time I'll just run in real quick. You just keep pushing the bar, right? You keep getting a little bit more relaxed. Seeing the general community spread that we're seeing right now would give us indication that potentially distancing or masks are not prevailing. My other observation is when we are doing contact tracing, we have also heard significantly the communication, we don't know where we got it. I have no idea. I don't know if that is, I don't want to share the information, if that's truly, I don't know where I got it. But those types of reportings are concerning because if we don't also know where people are necessarily acquiring it, we don't know where we can also improve. The workload has increased drastically, as you all can imagine. I'm hiring new staff so that we can begin to catch up, but there's no way to process almost 1,000 positives over a month. That workload begins continuing. We've seen the increase in positives also reflect as well as the increased average hospitalizations as well, and so it's just concerning across the board.
So I'm curious also, how are you characterizing the county commission? Because again, they are, as early on, we wanted to follow the lead of the county. I think it is confusing when two bodies issue different recommendations. So I'm curious about, so what is the county's hesitation in not, so what do you anticipate, or what are you seeing that their hesitation in helping you offer further direction?
Sure, so it's precarious for me to speak on behalf of the county commission board. I did try to ask that question to get that clarity from the board yesterday.
Yeah, I don't want to put you in any position
Yeah,
that,
no.
so.
What was specifically stated in yesterday's meeting was a hesitation to take away people's freedoms and liberties. That was specifically stated several times. Of course, maybe fleshing out that in a city-county meeting, I don't know if that's an opportunity, but that might
Well, I will tell you early on that we had anticipated that we would be included as the city
Sure.
in, some type of a task force, and that's never happened. And so I've spoken a couple of times with county commission, and I still think that's a good idea.
Absolutely.
But I having us at odds, or even with the city of Holcomb, and not really, here we operate together. That's really where our success has been.
So a quick update on that. We did have a small meeting today to initiate the discussions of a task force to bring it together for communications enhanced, proactive measures, communications in our city and county, so that we can increase awareness. We are looking for every opportunity to increase that awareness and slow the spread as much as possible to help alleviate the pressure off of the hospital.
My last question, and I just, so
Absolutely.
to make sure, so this idea, and this was presented a long time ago, and someone else, Dr. Burns, I know that she's the medical director at the health department, so she might speak to this also, but this idea of herd immunity. So early on, I'm just saying that the goal was to make sure that we were prepared, knowing that at some time there was going to become, where we had to have herd immunity, until the vaccine was developed. So I'm curious, is that no longer something that you thought was going to happen? Or, because I'm kind of surprised that we're surprised that this are you saying because of the uptick in it? Or I always thought that was something that was going to happen, and I'm just asking just to be educated, so.
Sure. So if I recall correctly, the percentages for herd immunity, do you
and I can
need a
speak to
discussion?
that.
Okay.
Okay, yeah, if you don't mind, I'd appreciate that, because
Do you rather than, absolutely.
You finish what you're saying.
yeah. Okay.
I'll take lots of questions.
Okay.
So I don't recall the percentages exactly.
I was curious about that.
But from the state's opinion, Dr. Lee Norman at KDHE, the percentages are so high that the state of Kansas isn't even anywhere near herd immunity percentages to even talk about it being effective.
Okay.
So you're looking at, I believe he used at least
We're 60 to
40.
70%, and that, with the mortality rate that we're looking at, the cost of human life would
Lindsay,
be...
Dr. Burns, please step to the mic so everybody can hear you,
Yeah,
please.
I think these are,
I'm
valuable.
sorry, I said I'd wait.
No.
And I do. I'm so very happy to take all of your questions, and I want to speak to all of these. But I hate to talk over Colleen's shoulder. So when we talk about natural herd immunity versus vaccine herd immunity, those are different concepts and different things. So the strategy laid out by public health with the management of disease in general, whether we're talking about measles or anything, is to achieve vaccine herd immunity. Because the strategy is to achieve efficacy of immunity without loss of life. And when we're talking about a mortality rate that we see that's associated with COVID, and we need to achieve 60 to 70% infections, that cost of human life is untenable. It is untenable. It is on the order of millions across this country. And furthermore, we don't in these discussions of mortality, we have not taken into account morbidity, nor the unpredictability. And I think that was a fantastic point you made yesterday, Colleen. I wish, she gave such a fantastic presentation yesterday. But if I could emphasize anything as my personal experience as a treating physician, the unpredictability of this illness and the vast array of affectations is terrifying. We cannot afford, nor can we ethically recommend, take your chances and get this virus, and I hope you don't get it too bad. That is not a professionally ethical thing to say, and so that's why the public health strategy is to work towards vaccine herd immunity, sir. Thank you.
No, thank you.
So several other points there. She spurred several thoughts over here. Speaking on our behalf at health department, so we had several that became positive. Talking to the unpredictability of COVID-19, we had people that were hospitalized, critically ill, that we would have never thought would have ended up there. Marilyn Douglas, back in April, presented at County Commission and specifically spoke to COVID-19 being highly cryptic. That still resonates with me today. We have had 8 deaths in the last month. That's alarming. I want to keep kids in school. We are working very closely with Dr. Carlin and also Dr. Myers out in Holcomb. We look at this data, we try to make the best decisions. I don't want to see that full impact on our community. That is going to be difficult to navigate through. So I'm really just trying to find any possible way for us to navigate through this, find whatever precautions we can to help reduce the spread. One final point to just also give you. June 20th, we ended our drive-through testing out at the fairgrounds. Our numbers at that point were 12 positives a week. It was under 20 for 3 weeks prior to that. We are now at 289 positives a week. Yes, that has gradually increased, but that is a completely different case scenario. I hope that helps kind of convey where we're coming from and what we're seeing.
Do you have a question? So Colleen, I'm curious about my last question. I'm sorry.
Absolutely.
If any of you have other questions, please jump in. So of the cities who enacted a mask ordinance or mask mandate or whatever you want to call it, of those, did the county health department go to the county first and then they refused and then they came to the city, or do you know what the whole process was?
I know specifically in Saline, health department and medical director went to their county board. It got voted down, then they went to city and it got passed.
Okay.
And then eventually the county adopted that as well. Wyandotte Johnson, I believe they had a large collaborative and they were all on board with that as a working group, a task force that they had together to then pass those ordinances.
If there was a mask ordinance, how long would the mask ordinance need to last? I'm curious, is it 2 weeks? Is it, I know that was suggested at the county commission meeting.
Sure.
And you review at what point do masks become, something that you can no longer have to mandate? Because again, a mandate it's a serious.
Sure.
You're asking a very serious.
I think that needs to just be built into that ordinance. So a time period, I would suggest at least a 2-week, but it be a data-driven strategy so that you would look at the number of cases and those rates within the community, as well as hospitalization, ICU. So you would build all of those data metrics into that ordinance that would help you drive that initiative.
And I would be more comfortable in the ordinance that also, talking about that, having a task force of these people that you just mentioned, the city, the
Sure.
county, the hospital. So I'm going to encourage, and I'll speak with the county commission too, to encourage a task force that includes those people.
Sure. Sounds good.
Okay. Any other questions? Commissioner Arlo, do you have a question?
Well, I guess in looking at, a mandate or an ordinance, how do you see the enforcement of that working?
So this came up in yesterday's discussion as well. I haven't found out any additional information, but I know that we discussed talking to some of the other counties that had been successful with this, how they were working through that process. I know that there was a lot of discussion of citation and such, but I would really like to be curious with other counties and communities of how they have been successful so that we can kind of learn from them instead of reinventing the wheel here.
Thank you for all the questions
Thank you.
and all the answers.
All right, thank you. Appreciate it.
Thank you.
Thank you.
Good afternoon.
Good afternoon. Thank you for having us. I come to you as Haley Knoll, Executive Director of Family Crisis Services here in Garden City. I also come to you with 15 years prior law enforcement experience. I emailed each of you a document as to why I don't encourage or vote for a mandate mask. I'm not anti-mask, but I'm anti-mandate for the many reasons that I sent you an email. I'll briefly go over them, and I'm here for questions. I'll stay, I'll go to the next room. First and foremost, understand I'm not anti-mask. I'm not anti-precaution. I love the task force. I think that's a great idea. I'm all about raising awareness. We raise awareness for sexual assault, domestic violence daily. I'm all about raising awareness and encouragement. So just please understand that's where I'm coming from. Our clients from Family Crisis Services are really trying to get and establish their own freedoms from their abusers. Mandated masks, they prevent someone from being simply allowed the ability to just mouth, help me. You can't see, help me. And the amount of times that's gonna happen, honestly, probably not a whole lot, but when you muffle that and you take that away, it increases the violence for that person. In Family Crisis, we haven't so much seen a huge increase in violence itself, but we have seen an increase in the injuries, meaning that the abuse, the physical abuse, is more severe. And I'm not saying that's because of masks or anything else. I think it's everything. COVID is a disaster, and we all know that. Reference my 15 years law enforcement prior experience. If officers are called to a abuse situation and there's a mask mandate, you automatically put any injuries that are on the face hidden, and that's additional leverage to the suspect. If the officer suspects or asks the victim to remove their mask so that they can see and check, which officers are great, that's what they're gonna do. They're gonna check, they're gonna do their due diligence. But when the victim removes his or her mask, you've now given one more leverage to the abuser as you removed your mask. Why did you do that? You shouldn't have done that. And it's just one more opposition that the victim has to overcome. This further increases the danger of the victim when the officer leaves or when that suspect is released from jail. Further, as capable, free-thinking adults, we're all very able to maintain physical distancing and increase washing, disinfecting procedures, and wearing masks when appropriate. However, coming in here today, I saw 4 doctors get on the elevator when there's clearly a posted sign that says 2 per elevator unless you're related. Masks aren't the only answer. Masks aren't the only answer. People don't wear masks properly. People don't wear proper masks properly. It's also contributing to littering all over our beautiful Garden City. And adding to why people don't wear them properly, they're exhausted. People wearing them in employment places all day, they're not used to them being in doctors take them on and off, whatever. But you go to Target and people are exhausted. They're not wearing them properly. So it's null and void. It's not serving any purpose. Many businesses have already implemented plexiglass and dividers. Those are the barrier that also stop any of the sprays that were discussed. Constitution and laws in general, I've kind of touched on this, but who will enforce it? Don't put this on law enforcement, and understand that comes from me and my experience, not from any currently serving, okay? This is my 15 years experience, but that should speak for something. Don't put this in the court system. A mask to go to court, to have to go to court for a citation for mask or an arrest, it further bogs down our court system for our victims who are trying to seek true justice from true crimes. Additionally, you put officers in a possible use of force situation resulting in a lawsuit against the officer and the city. Some people will fight cops over a mask. They fought them over less. And I feel like if you put a mandate out there, you're putting officers in a bad position. And again, that comes from me, not Chief Utes, who I love and dearly worked for. With that, mandates with no enforcement or consequences are worthless and simply continue to put people at odds with each other, and they'll just be the private citizen mass police. LEO don't need that on their shoulders. Consider the hearing impaired who are also used to reading lips, who also struggle anyway hearing, and then you have the mask and the plexiglass and all these barriers. Mental health, they've already touched on some of that. Some of that's already being closed down, and that is incredibly unfortunate because we're seeing a mental health deficiency increase. And with, again, coming from my experience, suicide season is coming. Holidays are terrible, and the numbers for suicides increase, and this is just a breeding ground for that. I don't envy any of your positions. I thank you very much for what you do and volunteering to be elected to be where you're at. And good luck to you, and thank you for your time.
Thank you so much.
And I'll be around for questions if you have any.
Okay, thank you. Good afternoon.
Hello. Hi, my name is Darla Sammy. I come to you just as a citizen. I sent all y'all, an email earlier today, but I don't think that y'all got a chance to take a look at it. My concern is mandate. I don't think that's right. I think maybe a recommendation, maybe some additional information sent out to the public, either through y'all or through the county commission. A mandate's not right. Government doesn't need to be involved in this. I think that y'all have a responsibility to keep us safe. Let's deal with some recommendations. Let's educate the community. Please don't do a mandate. Thank you.
Thank you.
Thank you. Good afternoon.
Hello. My name is Donna Gershner, and I've lived in Garden City since 1986, and I'm a lifetime Southwest Kansas resident. My family is from Copeland, and they do their shopping in Garden City on weekends and always eat out when they come. Since that, COVID has changed everything. My brother, who has diabetes, will not go out and eat in Garden City due to the numbers of COVID. He was shopping here wearing a mask until he saw the number of people wearing masks has dropped every time he comes. He tried the online, but found out they put substitutions in, which he does not like. He's kind of a picky guy. And he now shops in Sublette where there are less people, so he doesn't have the chance of being exposed. He does not like doing this because the prices are so much higher in Sublette. But the numbers of non-mask wearers, he feels that here in Garden City, it's the only safe way by doing it there in Sublette. He will continue to do this until there is a mask mandate or they have decided that this COVID situation's over with. He is not the only one doing this from Copeland. There are others that are not coming here shopping. This means that we are losing money in our community, and I know that has been a huge thing that you've been thinking about is the economics. Well, we're hurting our economics by not providing safe atmosphere for people that are coming shopping. I continue to go out and eat and wear a mask. I'm not afraid to go out. I wear my mask, but I look for places that the staff wears masks to protect me. I'm a high school volleyball official, and I ref all over the state of Kansas. And as an official, we are mandated to wear a mask into these schools. However, each school can choose whether or not they are requiring a mask mandate. Some schools do, some schools don't. When this first started in September, I went to Scott City. They had just had a mandate. They were wearing masks, doing a great job. But the school then again told me that, well, we're not requiring it, even though the city has a mandate. Then I went back in October. I walked in there, nobody was wearing a mask, just me and the other official. You talk about a scary situation. And as a contracted official, I gotta stay there. I gotta officiate the game or I will not get that contract back. So you didn't know from school to school what was gonna happen. The one thing that we did found that most of the schools were complying. They were doing what? Keisha asked them to do is try to provide a safe atmosphere, but it was always up to the schools to do this. At postseason, that was a different situation. The state of Kansas, Kansas State High School Athletic Association, mandated masks for all fans, for all players sitting on the benches, and for obviously all officials and table workers. I worked at the state tournament just this last weekend. Everybody was wearing a mask. It was not a problem. Everybody was having a good time. People were able to breathe quite easily, and there was little grandmas there. Nobody was having a problem. Nobody was having any issues. They did the right thing. They also allowed for social distancing by roping off some of the bleachers so people couldn't sit close to each other. So they did a good job, and they had hand sanitizer everywhere. So I felt very safe, and I wasn't afraid the entire time. We even had a team there because they were concerned, because they were in Western Kansas. They wore masks out on the court, which that wasn't a mandate. You didn't have to wear it when you were on the court. As soon as you came off the court, you had to put your mask on. And this team did that. Now, I was very proud to be part of that tournament because they took safety over the right to choose to wear a mask. We make people wear seatbelts. We make people wear shirts and shoes in food establishments for safety reasons. Why is this so different? It's just a small inconvenience, and most studies show that it does make a difference. We need to listen to our medical community and do what is right for the health of our citizens so we can continue to live freely and not go back to what happened in March and April. Thank you for your time.
Congratulations, Donna, on your recent award too. But do we have any questions for?
I do have a quick one. Could you talk for just a second about T21? About, because I
Yes,
believe
I
that
definitely
ordinance
can talk-
started at the city, right?
Yes, I definitely can talk about T21. T21 was an ordinance that started in Garden City without the county, without Holcomb. Then it went to Holcomb and it passed there. Then finally, the county got on board. So you guys can pass stuff without the other entities. You guys can set the precedent. You always have, and I hope you always will, because you have the forethought to do what is right for our citizens. Thank you.
Thank you.
Thank you.
Do we have others who? Is there anybody in the other room, or? And we know it takes a little bit of time to get over here, so we'll just be patient for a moment while they're checking.
Yeah, Chief Utes went back there.
Okay, yep.
I don't know if he'll come back.
Okay.
Hopefully he'll come back.
He may have just left. I was just over in the other room, and I believe everybody that was there was either staff or was speaking, here to speak to another item.
Okay.
And the three that I was advised were across the hall have all three spoken.
Okay. Okay. So with that, Dr. Burns? That moves you to now you're first, being the first at last.
Good afternoon. Thank you so much for having me. I am speaking to you today as a physician, as a working hospitalist. As you all know, I work in the ICUs and the med-surg floors at Via Christi and Wesley as a hospitalist, and I did just complete my COVID rounding time last week. And I'm more than happy to speak about the situation there as it pertains to us, because we are a regional system of patient transfers, and I know that because I'm the triage person who takes all the calls from Western Kansas and around, and I know the kind of desperation and the situations that are happening in the outlying facilities that are requesting transfer, as well as my own facility when we request transfer to higher levels of care. When we talk about no ICU beds, I just want to make a point before that leaves me, because you all know that I become quite tangential on topics, but that's not just, at this very one moment in time. That's every day I went into work, the board said 100%. That's me calling the bed control and the ER and trying to move patients around constantly. So when you see that on a rolling basis over and over and over and over and over and over, at a certain point they say, maybe we need to put a tent up in the parking lot.
It's time to move to contingency plans. That's what they're talking about, okay? To start with my petition before you today, again, I'm speaking on behalf of myself as a physician, as a public health person, as a hometown person who's very invested in this community, as a former commissioner. I have no authority to speak on behalf of the county nor the county health department. Unfortunately, the word mandate has become quite toxic, and yet that's what I'm asking of you. It's never my intention for that to become toxic nor political, nor was it any medical professionals. I find, and I think Ms. Gerstner started to make this point quite clearly, and I'd like to just bring that out there, and my mask is falling down because I talk so much, but I want to talk clearly to you, but I want to keep this in place, and here's why. Me wearing this mask stops droplets from touching this microphone, from going across the room. Droplets are what that virus is attached to. In the hospital, we wear N95s when we are doing aerosolizing generating procedures. That means putting an endotracheal tube into someone's air tube, okay? Aerosolization is an important concept, but that's not what this mask is designed to stop. It's designed to stop droplet transmission. That's what we're talking about. So we can argue about micron particles, and I'm so happy to present you with primary sources, and I will give you primary sources. I think I've probably already given you a lot of primary sources when we talked about this in July. Duke University has a fantastic published article about all different kinds of masks and all different kinds of experiments that they did. We can talk about that, but I don't want to do that right now today because I think that science is clear. At this juncture today, all health professionals will tell you, all health professionals with an understanding of epidemiology and public health and who have looked at the primary literature will tell you, me being one of them, masks are one piece of a deterrent, an effective deterrent to stop disease transmission. The study that Dr. Swati showed you from KU Social Policy Institute, that actually looked at the question of mandates. Well, how do mandates help? Well, we can just look at counties that had mandates or municipalities within counties that had mandates and not. And they had differences in their disease transmission. So just take that for what it is. And we all know we can make interpretations and caveats and try and interpret that data, but take it for what it is. And I have such faith in people that want to take care of each other. I do. We all do. That's our human nature. We want to nurture each other. We want to take care of one another. At some point, the analogy of what a mask does was changed to be something that I do for myself. It's a choice that I make for me. The correct analogy is not to a seatbelt. A seatbelt protects you. The analogy is not wearing a mask is acting as a drunk driver. And maybe you don't know, you're not intentionally spreading virus. We know that people asymptomatically or with very subclinical symptoms, I just have a runny nose, just my allergies. That's what happened in our health department. That's what happened at the jail. That's what happened at the city court. Our municipal court was shut down. It wasn't intentional. But it was intentional not to do the things that we could do, that we knew might help. And it's like that Swiss cheese model. Masks are part of it. Social distancing is part of it. Limiting, hand washing, absolutely. Limiting your touches to things. And I recall being back here before you in the spring, and we talked about this, right? We laid out the president's plan. We talked about encouraging. We talked about messaging. The mayor's daughter is our fantastic social media person at the health department. She does a great job messaging. The message is out there. It's how it's interpreted, how it's modeled. I wish it didn't come down to a mandate, but that's what I'm asking for. That's what I'm asking for. I'm asking for you as elected officials to use the tool in front of you that you have. Not asking you to intubate anybody, not asking you to come down and call patients' families from the hospital like I do. I'm asking you to use a tool to say, we're going to set an expectation in this community. We're going to set a consistent expectation. And it's for the public safety. It's analogous to traffic signals. It's analogous
We have to put some orders in place to keep society safe. And that's within our purview. And unfortunately, it has become this, you must have some great courage to do this, but really you don't. What you have to do is look at the fact in front of you, look and see what you're seeing, listen to what people are telling you, and asking for help, and doing what is within your purview to control and do. I am so happy to talk about specific points about why masks specifically work. I'm happy to talk about herd immunity. I'm happy to talk about how hospitals work, anything. But I wish I could say the recommendation's going to be strong enough and maybe everybody will get on board this time, but that's not the case. It's changed. The nature of it has changed. The narrative around it. You've heard folks talk about the narrative around it. It's not a personal freedom issue. It's not. You're not taking away anybody's freedom any more than when you tell them to stop at the stop sign out here, which we have no problem with. It's what we do for each other so you don't T-bone somebody's car. Please, if I could convey anything, I think that's somehow gotten lost on folks. This is a choice to protect someone else. And as someone who saw what this disease does to people, it's incredibly unpredictable. I am thankful for the folks. I'm thankful for the gentleman who sat here and said, I had it and it was terrible. He didn't end up in the hospital. He's not on a ventilator. Didn't have to come off a ventilator and go back on a ventilator. He didn't die. Good. I wish I could say that is the case for everyone. And I talk to my colleagues, and we're calling each other saying, how do we sustain this? How are we going to make it to Christmas? What's going to happen when everybody gathers at their families' houses for Thanksgiving? We see families all end up in the hospital together. And we can't tell you why it ravages some families and these folks do fine and maybe these folks just have sniffles. We don't know. Maybe someday we'll know. But that's why I came to you. And I'm coming on behalf of myself as an individual. And I understand the pressures that other people have as leaders of their organization, to not use toxic terminology. I don't want to alienate anyone either. They don't want to alienate anyone. But our recommendations and our messaging, despite our very best efforts, have yet to spur the action that we need. And I wish we had time for a task force to get everything together, but we don't. We are in a crisis today. And I promised my colleagues I would pull every emergency brake I could, and that's what I'm doing. But my authority, and Colleen's authority, to put in orders have been stripped. It is to you. It is to you. The governor doesn't have authority to do this anymore either. So it's within our community to take care of one another. More than happy to take questions.
Questions, yes.
So
Commissioner Dick.
when we're looking at, not a success or whatever, but when we're talking about did you survive COVID, we usually talk about did you die or not, right? And when you have a cold and you even if it's a bad bout of cold, a week later, 2 weeks later, you're fine. I mean, no real damage is done. I haven't really heard too much discussion about what are the other issues that come about COVID besides let's just try not to die. Are there other health issues that are related to an infection that aren't necessarily even getting reported as issues currently or issues that patients might have in the future because of the infections that they have now?
Yes, outstanding question, sir. Yeah, I will tell you, what we're finding is that this is a very vascular disease, so we're seeing strokes, heart attacks, pulmonary emboli. The virus also, as many viruses do, can affect the heart, and we see cardiomyopathy. I had a young patient, I say young, 35-year-old patient who now has a very severe cardiomyopathy. That will carry, his heart won't work for the rest of his life. He will be disabled. Let alone the scarring from the respiratory issues. Not everyone with COVID develops a respiratory problem. That's what we've learned. That's what we've learned over this last 9 months. What we learned is, people, I think what's so profound, and what's so profound to me on the service, is people get so short of breath that even just movement hurts them. Just movement makes them short of breath, and very high levels of oxygen. And traditionally, when we're working with ARDS or other kinds of pneumonias or obstructive things in the lung,
by putting someone on a ventilator and just pushing as much oxygen in as you can at high pressures tends to help that. That didn't help with COVID. What we had to do was recruit more surface area of the lung. So about 4 months into this, we figured this out. That's how that evolved, because this was a new disease process. It's a new disease process. But we've now had a really long amount of time to now start to sort some of this out. So the high levels of oxygen necessitating more lung surface area and those things led to us not needing all those ventilators, because now we're proning people. But you know what else we're doing? We're having to do extracorporeal oxygenation, which is like heart bypass. I mean, it really is a systemic disease. And I think that's, when you see the MIS-C that affects children, it's a vascular type disease. It's very similar to Kawasaki's. So, you know, we're looking at people who have long-term decrease in their pulmonary function, certainly, for whatever reasons, whether it be scarring, excess fluid, whatever's happened within their lungs. If they had vascular injury like pulmonary embolism, we see heart problems, we see strokes, and the residua of that. There are reports about people, especially, and this is also known, people who are on ventilators for 28 days. You hear about people being in long-term. That's the other thing. Long stays in the hospital. That affects capacity. Not a rapid turnover. Those folks have to be sedated to be on a ventilator to tolerate it. What are the long-term, you know, and then people have been looking at this before COVID. What are the long-term effects on your brain, your liver, with that kind of drug in your body for so long? So there's so many effects.
So kind of a follow-up question, and I don't deal with insurance companies because of, I mean, that doesn't, but you probably do as a doctor. Do you feel like this might become one of those pre-existing conditions that might cause further troubles to these people where, I mean, if you're applying for an insurance policy, one of those things is, did you have COVID? Yes, no. If yes, then you're in a higher premium.
Absolutely.
I mean,
Or, did you have a pulmonary embolism? Now you're on long-term anticoagulation. Do you have a cardiomyopathy where now you have a reduced ejection fraction, have to be on 4 different medicines to manage that and have a defibrillator? I mean, yes, absolutely.
Okay.
By
Thank you.
definition, it will be.
Thank you.
So I'm curious about, and I'll ask her other questions too. So I heard the trend lines. I think Dr. Carlin talked about 17%, 23%, 31%, 41%. So what's that look like as far as overwhelming the system? Because 41% seems pretty high to me, and I'm not sure what the current testing is at the health department.
Yeah, and we've
So
discussed that quite a bit. Statistics are statistics. We have to choose a metric to look at. We have to have something that's a marker. Commissioner Dick and I have had discussions about this. There's extensive, if you look at the Johns Hopkins website, they talk about what are epidemiological markers. Is a percent positivity rate a perfect measure? It is not, because it is influenced by how much testing you do. But what we've tried to do at the health department, because we had competing values, right? We needed to get access to as many tests as possible, which was difficult at the beginning, getting people to those tests, and then being able to deploy those tests. Sometimes that means getting tested at Scott City or Kearney County or over at Dodge if you work in Dodge but you live here, and then those tests have to be communicated back. People had different testing systems. Genesis had the ability through some grants to get some different testing there. Private clinics had access to labs we didn't have access to through KDHE. So with all of those things, we were trying to still keep our data consistent. And so when Colleen's reporting that positivity rate, it is our positivity rate in the county.
So it's not just the health
We are controlling our
department.
data for it. Right.
Okay.
Are there a whole bunch of people that we're not testing that are positive? Obviously. But it's a proportion and a marker. Okay? So rather than talking about it as absolutes, look at that trend. Look at that exponential growth. And what we know, when I look at that as an epidemiologically trained person, I have a master's in public health, and is our medical student? Pay attention to, if she's out there listening, pay attention to that fourth year, health of the public class. You look at trend lines, but what you say is, what's driving that? Well, that was transmission. Commissioner Jones asked yesterday in the commission meeting, well, what happened? We were okay in July and August, indeed, but we hadn't squelched it, and everybody got a little too relaxed, and it built, and it built, and it kept moving, and now, instead of being on this part of the exponential curve, we're on the steep increase. So if I could say and parse the statistics in that kind of way, look at the trajectory. And I think that's why it's very hard to start saying, well, if we're under 20%, then it's okay to lift the mandate. Well, maybe not. Maybe that absolute number is not what we should be looking at.
So what do you suggest is,
I think we need to
because
look
I
at the
think
metrics that we
absolute
created.
mandate forever, that's not,
Yeah, and it is the measure that is reported because it's a metric that we can look at so often. Across
so what
the
metric
counties.
are you suggesting?
So we have a metric in the county about severity levels, and when we talk about the school operational levels, we went through and matched that to what our metrics are. And I modeled that off of the state system in Ohio. And it's based off of several different criteria. It is that positivity rate. It's also what our outbreaks are. It's also what, and I think that was provided at some point. I'm happy to provide it to you again. I don't know. I've provided it a lot of times. But I could show that to you. And that's what we're trying to use to give a data-driven, it includes hospitalizations, it includes what the hospital capacity is. You know, we talked about this at length at the school board meeting the other night. We tried to set up some sort of criteria so that so it was applicable to businesses, so it was applicable to organizations, so it was applicable to the school, to the junior college. Here's where the county looks like it is. Flex your operations to match what this rubric is. Now, I will say, we wrote that in the summertime. I hadn't written anything like that before. I had to take a mulligan at the school board meeting and say, I'm not sure I wrote it strict enough. Because the conditions that I see now, I wasn't able to weight things, I guess. I didn't see a way to weight things more, oh my gosh, what if the hospital's completely overwhelmed? Maybe that should get 2 flags, you know? So I had to say, I think we should be more conservative. I think we need to take a more aggressive approach in our mitigation efforts. And whether, you know, my recommendation was, I think we really need to take a look at fall sport or winter sports compared, because we're in a much different situation than we were before. So with that exists, we did our very best, but also in real time, we have to look at the situation that we are seeing. And I think that's what we're all coming here trying to convey, is we are trying to communicate what a dire situation our community is in. And we are asking for everyone, this has to be an all-in together effort. If one person walks in here without a mask, it negates all of us wearing masks. It takes one person. That's why the mandate and the expectation, I think that's very important. I think the expectation that it would set, that I don't have to feel weird asking you to put your mask on when you come into my store, or feel like you're going to turn and walk out, or yell at me, and there's always going to be extremes on both ends. But I was standing in the county office waiting in the voting line, and the lady behind me walked right up close to me, no mask, and I said, "Do you have a mask?" And she said, "I do." And I said, "Would you mind putting it on?" And she said, "Oh, I don't have to." Well, what if the expectation was, no, we all are going to? Then I don't have to stand there thinking, oh man, I hope I don't get COVID because I have to go back to hospital shifts next week, and I have a responsibility to my partners and the patients, and I really don't want to go home and give this to my kids because I don't want them to go to school and give it to their teachers. That's what we're talking about. So I know that the word mandate is toxic, and I'm sure there's lots of litigation. Whatever. In my practice, I have always done what I knew was to be right for the patient and worried about other things later. If you always do what's right, what's in your power to help someone, then you're always on the right thing. You're always going to do the right thing. When someone asks you for help, help them. There's always going to be somebody who's going to try and sue you about it. They also tell you that in medical school. So I can't speak to those other arguments. I would. I tried to speak with that man, but he walked away from me and wouldn't speak with me.
So I'm curious about, and you might have to defer to Dr. Carlin. So when you set up that 7-tier system, so does that move automatically based upon the numbers, or does the school board come back in and move that, or who makes that decision?
So we just fill it in and then
I would have Dr.
make our
Carlin
recommendation.
answer that question.
Absolutely.
We meet twice a week with representatives from the health department. One of the meetings is to look at the level, the baseline level that we're going to use, and that's where we use the gating criteria that Dr. Burns and Colleen developed. We said from the very beginning that it's not a magic formula that spits out the answer. We look at a lot of data to try to inform our decision. So there's 6 flags or indicators in that, but we also look at our student attendance, we look at our staff attendance, we look at our substitute availability. So our goal has been to use evidence and data to drive the decision. And as she said, nobody's ever been through, at least nobody that's, here has ever been through a global pandemic of this scope before. So we feel good that this gives us a framework to follow, but we also don't think that there's, anybody out there that has the answer on this. So it is a living document. And then our 7 levels are basically just increasing levels of restrictions that are more masks, more social distancing, all the way up to the most restrictive where we keep students home and teach them remotely.
So I know, Dr. Carlin, since you're here, I want to ask this quickly. So, I know that when students go home, so if you would get to the level where there is no more in-person school, and I know it affects families because most families work. So I'm curious about what does that look like for our business industry, and also, do you have comments on, when parents now have to come home with their kids? What is that? What are the comments that say?
Certainly that we understand that this will have a big impact in our community because parents are going to have an issue with supervision. Some parents with an issue of supervision or childcare for their kids that are not able to come to school. But it's that balance, and that's where, for 9 weeks, we have been able to do, and we're in our 10th, we've been able to operate face-to-face school, but that's not the norm across the state. There's still school districts out there that have not had full weeks of face-to-face school with their kids since this began. As Dr. Burns said, our situation looked differently at the end of August, at the beginning of September. Our case numbers in the community were much smaller. Our positivity rate was not showing the trend or near at the level that it is now. But we're in a different spot. The last thing in the world the school district wants to do is to move to hybrid or remote. But we're approaching an untenable situation. Again, guys, I've had over 100 staff members who have tested positive, and the trend over the last 4 weeks is increasing. Our staff is at incredible risk. They have 25 kids coming in their classroom every day, or several hundred in their school, and we don't know what those kids did the night before. We don't know if they're from families that are taking this seriously and they're taking precautions, or if they're people that think that there's nothing to this and it'll take care of itself. And so I have to balance the safety of our students and staff with being able to deliver the best educational system we can at the time. But right now, if our numbers don't improve, we can't continue in face-to-face.
Dr. Carlin, did you say earlier that you thought possibly 100% of your positive cases come from outside of the school district?
I don't think it's 100%. No, we've had some situations where we know we've had transmission at school. And of course, there's not an absolute with that. My estimate would be 70 to 80% of our cases are being contracted outside of school. We've had probably 4 or 5 situations where we've had at school where we're very confident that there was some transmission that happened at school. But a lot of ours are happening in households. One spouse gets it, brings it home to their spouse, who's our employee. And again, through the work with the health department, with the screening that we're doing, with the mask wearing, I think that's what has helped us prevent that employee then from coming back and spreading that to others at school. And we've typically been able to pick those up and quarantine or, get those people tested, and then they haven't infected others. So I had COVID too. I believe I got it from one of my kids who came home. And one of the things that I was the most thankful for is I don't believe that I am responsible for infecting anybody else, especially at work. But we're religious about mask compliance. We're religious about social distancing. And if I understand the current data correctly, you might be the most infectious in the 24 hours before you start showing symptoms. And that was the day of a school board meeting. So I had the potential to infect quite a few people, not only the people that I work with every day, but 7 elected officials. And so I think our experience and our data shows that this does work. It does make a difference.
Thank you.
I just want to make a couple more comments. And Colleen said, remember, it's the data that we're collecting at the health department, not within the whole county. That's true. That's what I just didn't finish my sentence. Yes, because we're trying to keep that consistent. And she has done this and created those reports that you see all of the time that are posted on our website, especially trying to get that data out there. And we are trying to present data for data-driven people in the best way that we can. I do want to speak to a couple of things because I think we have a unique community. I'm very closely tied to Sedgwick County and what goes on in Sedgwick County too. We knew that given our workforce, given the hourly wages that people depend on, we knew going into this that it was going to be very important to try and keep schools open. And we broke and did a modified quarantine, which was certainly not the norm across the state, but what we thought was epidemiologically sound and safe. The priority was safety. And it has borne out to be good. And a lot of other districts, as they're talking about going back into the classroom, are talking about modified quarantines. We did that in collaboration with the school in trying to figure out the best way for us to accomplish our goals. We knew parents were needing to go to work. We wanted to keep those kids in class. We knew that the economic vitality of that family or survival of that family would depend on it. We know, and we've talked about that for years in this community, their schools serve to also care for children. We knew that. So much has been learned over these last few months. Like I said, that's now being adopted more widely as people are trying to go back to school. But look at Tyson. Tyson has adopted some pretty stringent mitigation efforts because they suffered hugely with their workforce being infected, hugely. That drifted into our community. We suffered. But they looked at that and they said, okay, we're going to lock this down. And they did. Masks, barriers, hand washing. You're symptomatic, you're done. And it's worked. But that, unfortunately, has not been the model that's been adopted as universally as we need it to be. And quite frankly, when the horse got out of the barn, the only thing to do is just start battening down all the hatches. And I guess, you know, none of us want to go back to what it looked like in the spring. But we have to do something different. And Mrs. Dries asked the county yesterday, and I guess I would leave you with this question too. If a mandate's not the answer, what is the answer? What will you do? What will you have us do? Because we have to do something differently. I really appreciate your time. Thank you for listening to all of these nice folks who came up and spoke. Obviously, all are very invested in our community, and that's encouraging to me at these times.
Thank you.
Thank you.
So I do want to ask a couple questions of our council, just to make sure I understand. So if there is a mandate, if something is put into place, does that impact anyone within the city limits?
That is correct.
But then
Only within the city limits.
And that includes like the college. I don't know what they're doing now, but
Yeah, it would depend on the extent of the ordinance as it's drafted, but it would be anywhere within the city limits generally, unless specific exemptions are included.
have there been these type of, other than just the mask mandates, have there been examples of this in the past that you can recollect, or?
Well, as far as like, to me, it seems similar to the indoor smoking ban.
Mm.
I mean, that's essentially anywhere indoors within the city limits.
Mm-hmm. Thank you. That's a lot. So I want to make sure and give the commission any chance to ask any other additional questions, make any comments, and again, making sure that where we move from here or what we do next. So we've heard some very passionate people all the way through, and I want to thank everyone for coming. I mean, spending the time here and making sure that you make your appearance and your voice heard is important. So Any comments or from the commission?
Well, I know if it is, I mean, we have the option to choose to consider this, choose not to consider it. And I know Commissioner Burns, sorry, Dr. Burns, used to be former commissioner, but this won't be taken up. I mean, we can say to have staff look at this, put a ordinance together, but this won't be taken up to be voted on until the 17th of November.
Or you could call us,
Or we could call a special meeting, that's true. I'm just stating that.
And the ordinances of the places that have done it are pretty consistent. The legal staff has done the research to prepare it. Law enforcement staff has done the research about enforcement, including contact with the other agencies. If you have an interest in hearing about some of that, the chief's available to comment on it. But the intent of this and really understanding how to frame those that wanted to come and update the commission on the status of COVID-19 in the community,
Right.
which you had before on your agenda, and those that wanted to come with a specific request of a mask mandate, being able to position those on an agenda item, honoring their right to do so in both those instances, but also honoring how does something become a business item on the commission's agenda, particularly with the notice that was provided. So that got an agenda as a petition, someone coming and petitioning you to take a specific action. If you have an interest in considering that, we would place it on your next business meeting, or we would make that the topic of a special meeting.
No, a special meeting has to have 7 days prior notification, or is it less?
Yeah, no, it's less. I believe there's kind of a vague statute. Jimmy can look it up, but it's adequate notice.
Okay, adequate notice.
We've called special meetings within 24 hours before.
Well, is there interest from the commission in considering a special meeting? I mean, I know there's been a lot of information presented. I would like to have a chance. I've gotten many more emails than I've ever anticipated on this. And I've not had the chance to really go through this. I mean, I've looked at the studies. I would like to review the health department. I want to say to the health department, I really respect the work you do. I appreciate that you're here. But I would like the time to really review. Could we call a special meeting to consider this, or?
I think you're jumping the horse. Do we want, does the commission want to consider it at all first?
Exactly, okay.
Or do we want to not consider it, or do we want to consider it and make an ordinance, and what would that ordinance look like?
Right. Okay, so.
That's the question before the commission at this point.
Consider, not consider, or?
Well, I think the way that Garden City has traditionally been operated, so we listen to our experts and we listen to the best course available, and from what I hear from our medical experts and from what they presented, I think this does warrant at least consideration. And obviously we can't take any action now, but that's kind of what that setting up that meeting would be to take that time to consider an ordinance for this.
Yeah, and I would agree with Commissioner Dick. I think that this definitely does fall under considering what an ordinance or a mandate or whatever could look like. But if we call a special meeting, there's some time constraints that I would have. But I do believe that I would be in favor of considering something.
Commissioner Ortiz?
I agree. I mean, there's a lot of information here, and some of it had just sprung upon us today, so just giving us another chance to kind of go through that and weigh in on some thoughts, I think would be beneficial for us to make the decision.
Commissioner Cessna, you're.
I agree, but there needs to be, as we discussed, parameters or some way of measuring so that we understand, I mean, a time frame or a matrix, so that the mayor said, the mandate just doesn't continue on. I mean,
Right.
again, I understand we've had a lot of information thrown at us today to make this consideration. That's all I'm saying is, if the ordinance is written or put together, there needs to be a time constraint or a sunset, I would say, and some way of measuring this so we understand that if it's working, we can remove it, or if it's not working, we can continue moving on with it, that type of thing, if everybody's in agreement with that.
I think that, yes.
So to ensure that there's a defined time frame or alternative time frames in what you would consider as a business item. And then the other thing that I think it's worth speaking to is, and we've heard some reference given to, and then this was brought up in some of the dialogue yesterday at the county commission meeting, folks getting cuffed and stuffed over masks and that type of thing. I believe the ordinances we've looked at are infractions. And enforcement strategies that have been tried in the places in Kansas that have adopted ordinances are certainly along the lines of, what I would say is typical local code enforcement. You seek first for compliance.
Right.
The final step is the citation for an infraction. So, Chief, would you like to speak to that, just in case there's any elements that we would need to have the commission give us a read on for what would sort of be in the ballpark and what wouldn't be in the ballpark for including in our Garden City ordinance?
Yes, ma'am. Thank you. Good afternoon, Mayor, Commissioners. I've reached out to 4 different chiefs on their ordinances in Wichita, Winfield, Parsons, and Hayes. And most of their ordinances are the same. As far as the enforcement, again, in law enforcement, we don't make the laws, we're just objective and we respond. But the messages that I got from all the chiefs was make sure that we continue pushing community outreach and education. Have masks with us. If we find someone not wearing a mask, offer the mask up. If they refuse, then that's probably an enforcement action. Most of the issues that they found were in large groups, bars, restaurants, places like that. And some of the agencies require a supervisor to respond with the officer to help make that decision. In Wichita, I know the chief went to a location, 2 locations, bar areas, went in, saw that nobody was wearing a mask, so the supervisor was directed to give the owner or whoever was responsible for the establishment the citation. Very little citations were issued in all of these communities that I reached out to, the chiefs that I've talked to. So the way I see it, one is if we get a complaint, it would be similar to how we handle the smoking T21 issues. It would be obviously person crimes, non-person crimes are a priority in our community, and we respond. So it'd be a lower priority call, and the officers would respond appropriately. Infraction, some cities have it as a misdemeanor. I talked to Jimmy before the meeting. Recommendation is keep it as an infraction, so that it's the officer that has to sign the complaint, so that we don't get, I saw Dr. Burns walking down, I'm gonna pick on her today, and ask to sign a complaint. So it's gotta be an officer written complaint is what the recommendations from the chiefs are. But really huge on community outreach, education. For example, education pamphlets, the ideology of the task force. When we do a traffic stop, hand out education pamphlets. When we go to, even on our community policing efforts, hand out the pamphlets. Some agencies are doing inspections of businesses. I think we need to follow what our responsibility is the education piece in the ordinance, follow the ordinance, so.
And I think that was one of the bigger things that came out of the discussion today was that we need to, I think, and I heard it quite a few times, communicate
Yes.
and educate on this. I mean, you can put, and I understand, and I wear a mask where I go. I mean, the other day I had to go get milk, and you literally had to walk around the sign to get into the store, and it was a 6-foot tall sign that said you have to wear a mask to get into the store. And the other places that I went, you have signs plastered all over the front of the store. I think, again, it's getting into that if we could come together, and you know, we always talk about pulling together as a group, as one community. And I think if we work together as a community and educate everybody, like the numbers that were talked about, you know, it is increasing. We are having issues, you know, and like Dr. Carlin said, we might have to go to a remote learning setting next week if the numbers aren't going the right direction. And that's going to put a burden on our community. You know, that's what I've heard from the huge number of people that have talked to me.
Right.
Keep our businesses open and keep our school open, or vice versa. Keep the school open and keep the businesses open. But again, I think people don't understand, you know, they haven't heard the number, you know, ICU's full in our hospital. We can't transfer them anywhere else because all the ICUs and all the other hospitals that take transfers are full. You know, we have this huge exploding number of positive cases, and I don't think that's getting out in the community, or that's not getting communicated enough. I mean, here we spent almost a little over 2 hours talking about this. Maybe it is getting communicated out there. But again, I think we've and Dr. Carlin mentioned it, he saw for the last 3 weeks these increasing numbers, but all of a sudden, and it's nothing against our health department, but it's almost like we're standing in the middle of the fire and we're asking the fire department to drive into the middle of the fire and put the fire out. I mean, we need to somehow keep communicating to people in a broader sense on where we're at and how we're doing with this. You know, it's almost now we're into going back to where we were in March. You know, where at the end of spring break, everybody was going into this lockdown mode because it's like, what is this?
Yeah.
And I don't want to get that way. I'm just saying we need a task force or some way to communicate more effectively and get that out there, and as a community do that.
Well, and
okay, I'll get off my soapbox.
And I think part of it too is when we discuss about whether or not to have a mask mandate or to have one, I think that takes the focus off what the real problem is, and that's the increase in the COVID cases. And that the ultimate goal is to get those cases down. And here we are all hung up on whether or not to have a mask mandate or not. And that really, that education piece is so important, to take that focus off the masks and put it back on what the real issue is, and that is clogging up our hospitals so that we have no available ICU beds, not allowing our children to be in school. And that education piece is so important, and I think it certainly has to be a part of that. But I also would like to figure out a way to somehow bridge the two together so that we do see those numbers going down, because we're not going to. If all of a sudden we have a mask mandate and we have people who are adamantly opposed to wearing them, and so it's like trying to figure out, you know, how do we have that be a tool that we can use in that education piece and in the overall plan for what we need to do to get those numbers down.
Well, because one of the things that concerns me is, one thing as I was listening to the county commission, is this idea of limiting large gatherings. And so one of those large gatherings are churches. And I want us to be very, very careful about infringing on people's religious rights. And so we have to be very careful about how we're going to bridge that subject if we discuss this, because I'm sorry, I'm not willing to go against, you know, regulating or taking away people's religious rights at all.
And that's why, if we're talking about slowing the spread or stopping the spread of COVID, I mean, the tools that we have, I mean, it's masks, it's limiting gatherings and stuff like that. And I mean, better or worse, school is a mass gathering.
Yep.
And we are trying to keep that open by the way of taking other measures. And it hasn't worked so far the way that the communities have been going. One of the things we could
You said it
do
hasn't
is,
worked?
I mean, our numbers are
Yeah.
off the chart.
Well-
So instead of this conversation, I mean, if we were having mobile ICU units out in the parking lot at St. Catherine, we would be having a conversation about should we allow mass gatherings, not masks.
Right.
And to try to prevent that from being something that hopefully we don't ever have to think about. This is one of those previous steps that we can hopefully keep everything open like we've been wanting to do.
Well, there are protocols in place at the school district. They
Right.
have the levels. There are, they are following those protocols. I mean, again, this goes back to, there's a sign there that's like, you have to walk around. I mean, the school district, like Dr. Carlin said, has these protocols in place and they're following them and you don't see it that. But again, we have to educate the people on what's taking place in our community because it's kind of like, well, it's not happening. Well, the numbers are bearing that out and we need, and somehow through a task force, and it was said a number of times here, education and communication on what's taking place.
So I hear a consensus that we're willing to consider taking up something. Now it's really on to, do we do a special meeting? I mean, I know that time seems to be important.
And if you're willing to do a special meeting, I'm willing at a restroom break that probably should occur sooner than later.
Yeah, I agree.
Kind of have you huddle individually with Celine and I at a calendar and tell us what your blackout dates are, and we can try to identify a time, and then when we come back into regular session, give you what appears to be the windows where you're all available, and you could pick a special meeting time, or the alternative is the November 17th regular meeting.
Yeah, I think the November 17th is too far away. A special meeting would be my preference.
Can I ask one question to Chief? Just because I mean, just for us to discuss in a later discussion, if you would. Chief, have you heard of any, or what have you, I guess, gathered from statistics on like number of vandalisms or stuff going up because of masks? Have you had any issues with that since mask wearing?
Not since mask wearing. I mean, some of our crime activity has increased because of, we believe a lot of juveniles have stayed home at the end of the last year's school year and over the summer. We do see an increase in juvenile activity during the school summer time, and but it increased a little bit more. We're seeing an increase in graffiti, but nothing we can say crime related to wearing masks. We're working some cases now where the suspects aren't wearing masks. So.
Okay. All right, thank you.
Thank you.
So I know we'd like to, and I feel bad. Okay, if you don't mind, Scott, that's great. Could we take a reconvene at, do we need 10 minutes, or do you want to do Scott first, or?
Yeah, I think I'll ask Micah if she wants to, knowing what I think she came here for. I'm not sure, Micah, if you want to share information. I know we kind of moved on past, but she had done some work in the Chamber of Commerce. I think this can, and she and I visited late yesterday. I think this information can evolve between now and whenever your meeting is.
Sure, thank you. So yes, we did poll our chamber membership yesterday. We asked, we sent out a very short survey, 2 questions. The first question was, as a business representative, are you in support of a mask mandate? And the paper that I just gave you shows that of the 158 responses that were received, and again, this survey has not even been out a whole 24 hours yet, so it's very, very fresh. 53% of the chamber members are in support of a community mask mandate, and versus the 46% that are not. So it's very much split down the middle. And then what I was very happy to see was question 2, which was, do you currently encourage masks to be worn and social distancing guidelines adhered to by guests visiting your business? And 69% of the respondents are, and so that's really nice to see that. So some feedback that I did receive from a couple of chamber members was they would like us to go into a little bit more depth and ask some additional questions, and we can certainly put that those questions together and give those responses and provide that feedback to you if you guys think that would be helpful in making your decision. So just wanted to let you know that that's out there. We're going to keep the survey open for quite a while longer, and we have over 400 chamber members, so obviously there's still a large number out there that we hope will respond.
I think it would be helpful for us to make a decision if you would go a little more in depth. I mean, and you said it was only 24 hours that you got this
Not
response.
even, I pulled these results
Which is a good
12:30
response already.
today, and
No,
so
yeah,
it would
but it might be nice just to get kind of a pulse of the community. Again, like I said, the two things that I heard the most from Mike, the constituents that talked to me were, it was keeping the school open and keeping the business open, or vice versa. It was those two things that were critically important. So thank you for doing the survey and giving us this.
Thank
It
you.
was a little after.
Well, no, I felt bad. I didn't know if you had the survey results, and that's why I didn't know if you were going to speak or not. So.
Thank you.
All right, thank you, Micah. We appreciate it.
Thanks.
Thank you.
Okay, with that, can we do Scott, and then we will take a break?
Yeah, that would be great.
Okay.
Scott's been super patient.
No, he has been.
Poor Scott.
Thank you, Mr.
Welcome.
Mayor, for taking time to speak to me today.
No, we're glad.
And yay for democracy today, right?
Yeah, and Scott, I'll introduce your item just so folks that are watching us, and actually there's nobody left in the room, so if they're watching us online. But this is the governing body being asked to consider and approve a request from Russell Child Development to authorize signs for the Fantasy Tree Festival to be located in the city right away from November 16th through November 23rd. And the locations are listed, there's 6 of them, and this is consistent with the request from previous years. And so we just put it, well, no, I think there's one difference.
I think.
Because is it all virtual this year, is that correct?
Yeah, and in response to COVID, we have moved to an all-virtual event. We've been
It's a
doing
great
this event
event.
for 34 years.
Yeah, it's
And this is our first foray into the virtual. And so we dived in with 2 feet, and so we're absolutely way over our head and trying to get this thing done. And it's just a way to try to drive more folks to participate. This is our largest fundraiser. We've been in Garden City now for 55 years doing free services for families. And this is just a way for us to continue to market this thing and to have folks just some awareness to be able to do. With our 55 employees that we employ here, and we served over 5,700 children last year in 19 counties. Garden City is our base of operation. We are still paying for a building. We built a new building here.
Beautiful building.
Thank you. Thanks, Roy.
It was actually the mayor that said that.
Sorry.
See your mouth.
You cannot, you can't tell.
That's right, you guys are like
very hard.
up there. But we do, and we're a little nervous about getting the word out and getting folks to participate. And so I did give each of you an invitation as well. I hope that Matt gave that to you. And so this would just be our way of continuing to market that. We've been hitting social media. We've been putting posters around those community sites as well.
No, we appreciate that. So do we have a motion or a?
Well, I guess, so there is an updated, on the sign request. It's probably worth going through this because there's so there's a request to place signs in the right-of-way. The Parks Department sign is, we can work out the placement. That's been used for some other events before for marketing, I believe. And if staff I guess they're hovering in the hallway. If they'd like to come in and speak to the issue from both a planning perspective and the public works perspective, the lining the right-of-way is probably worth a discussion.
So I know Carol's here for neighborhood development. That works right there too, Carol, that mic.
Yeah, as far as signs go in the right-of-way, our zoning regulations do not allow signs in the right-of-way. There is a state statute that allows political signs, but that's it, not it. Oh, I'm out of breath. I ran over here too fast, I heard signs. Okay, so that's why staff does not recommend approval because of that. And I know before Andy left in Parks, he is going to the subsurface irrigation, which means if there's signs getting poked in, that could possibly disturb the lines. And so he moved over to not recommending approval as well because of the subsurface irrigation lines. And I'm not sure if there's any other issues.
Carol, I have a question. So that Peddler's Market, because I saw several of those signs up, were those in the right-of-way or?
Yes.
I'm not sure what.
That's actually where we got our idea from.
Well, yeah, because I thought those were in the right-of-way, so.
Oh, okay.
Those came before you as well.
Right, yeah.
And I'm not for sure, we'd have to go back and look, but I believe
We did not recommend approval on that the same way.
Okay, I couldn't remember.
But I'm not sure if it was what was in the staff report, but we would have had
Okay.
the same stance.
Thank you.
Now, I do believe we have the ability to put up a sign, there's like pre-fit posts at Stevens Park. Now, that's a different size sign, but I'm sure, Scott, that'd probably be okay, wouldn't it?
We'll work with whatever you
yeah.
Matt.
It'd actually be bigger and call more attention to it than putting those in the right of way.
And does Friends and Frogs have already existing posts or?
Yeah.
Okay, yeah, because I've seen several there too, so.
And
I
that
know
has
that's
some nice visibility too.
Exactly, it's a great location.
Yeah, now I think if folks are interested in having putting yard signs in their yard, people that are supportive of Russell Trout Development Center can probably on a temporary basis
Right, I was
include
just,
those in their yard, but yeah, keeping those out of the right of way, especially some of along Kansas Avenue where that new irrigation is subterranean, that would probably wouldn't be a good idea.
And when we did what were the signs that Tyson, We Stand with Tyson, or those signs? The issue came up then as well, and we just moved them back onto the the property owners of the commercial businesses that's just over the line there. So it was still along Kansas, it just wasn't on the right of way. So.
And the difference there, Scott, would it probably need to be with the permission of the
business owner. The business
not
owner.
probably, it would need to be
Right, yeah.
the permission of the
Correct.
business
Right,
owner, but
yeah.
my guess is you're gonna get pretty high receptivity to that. So sorry to throw a late minute wrench into that, but I think with respect to the Friends and Frogs and Stevens, we'd be happy to work with Russell to try to get bigger signs up at both of those places. And then give them some guidance on how to go about the other signs.
That would be
if
good,
The commission's okay. Is that okay with you, Scott?
I mean, at this point, we don't have a lot of time to change, and our thought was, since we were given that opportunity to the peddlers folks, and it was on the right of way, that since precedent had been set, and due to the fact that we're a nonprofit operating here in Garden City, with all those proceeds from that event going to support children that live in Finney County, that specifically live here in Garden City, that it would be an event that you would find it a possibility to support that fully is really what I was hoping for today.
Yeah, and I guess we didn't realize that the last commission meeting, that was the precedent we were setting, because I was kind of shocked when I was driving down Kansas that those were popping up
I
And I
thought
don't
they
remember
just,
seeing
I thought
in
they
the
just
request,
misplaced the
but-
signs.
I've
so-
never seen it in the request.
Yeah, I thought they'd misplaced the signs because I'd never seen them in the right of way, so.
You know, one, you're not a court, and
Right.
two,
Yeah.
Right.
that you didn't set a precedent, so.
Well,
Okay.
Somebody probably took some liberties on that
Yeah.
request.
And I
But-
definitely don't want to take liberties. I want to
no, that's
point
fine.
out the respect for sure.
Right.
Hey, thank you for requesting that.
Yeah, that's
But
great.
I will make a motion that we do allow the signs to be put at Stevens Park and Friends and Frogs for the Russell Child Development promotion of the Fantasy Tree Festival.
I'll second.
So it's moved and seconded. Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries.
And Scott, we'll have somebody get in touch with you right away, and
Absolutely.
if we can help you, I know you've probably printed up signs, so if we can help you on the second one, for Stevens Park, we'll work with you on that.
Absolutely, absolutely. I really appreciate your guys' time today. And
Thank you for
all you do
waiting and hanging around.
Yeah.
Thanks,
Yeah.
Scott.
Thank you.
Have a great day. Okay, so it is 3:25. Let's take, 10 minute, 5 minutes? Let's take 10 minutes. 10-minute break here, and then we will come back at 3:35. If you can check your schedules while you're at break, and then we can go ahead and let Sealand know. Okay? commission back into order. Thank you, everyone, for giving us a break. And so with that, Matt, we are ready to continue.
Thank you, Mayor. I think we're ready for item 6C.
Do we,
Yeah.
about the meeting time?
No, do we need to
Yeah, we
do
can
the
do that.
meeting time
So
first?
we do have meetings to note, and I figured we'd mention it
Okay.
there if you arrived at it.
Okay.
the Meeting time, so.
We did.
Okay.
But we can deal with that now. Have we identified a meeting time?
Yes.
November 11th at 10 a.m.
Will that work for you?
So 1 week from tomorrow, is that a Wednesday?
Yes, exactly.
Wednesday morning of next week at 10
10
a.m. And that'll be in the City Administrative Center. We'll put out notice. And that's a special meeting of the City Commission to consider an ordinance requiring the wearing of masks, so. All right. Item 6C, the governing body is asked to consider and approve free vehicle admission to Lee Richardson Zoo for active military and veterans November 14th through and 15th.
We've done this before.
We have,
in the
yeah,
past.
that's
Yes,
correct.
it's-
I'll make the motion to approve the free admission as recommended, as presented.
I'll second.
So it's been moved by Commissioner Sessions, seconded by Commissioner Euler. Any further discussion? I just want to say thank you to our military veterans. This is awesome. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you so much. Okay.
Item 7A, under report of the city manager, this is a neat project, and we've got guests here with, from representing the Finney County Humane Society. And both Mary and Vince have worked hard on this project. They've worked in conjunction with some Garden City Police Department staff who've also spent a lot of time with them. It's really, the plan was to design and fund improvements at the Garden City Animal Shelter for a portion of the large area outside of the building. It would create compartmentalized kennels with common play areas, and this allows staff to transfer the animals from the inside kennels to the outside kennels so that the inside of the shelter can be cleaned faster and more thoroughly. This is also an effective way in keeping the animals safe and clean, and in the event if there's rainy or snowy conditions where the soil will get all chewed up if you put all the pets out there at once. So I guess with that, I would invite, in whatever order you'd like, Vince, Mary, or our staff to talk about the project. And then also I think we could probably give an update on the funding strategy for the project as well.
Good afternoon, Mr. Mayor, Commissioners.
Good afternoon.
Captain Corey Pruitt. I'm here to talk a little bit. If you could go to the map, I'm gonna not read to you guys.
Thank you.
This is the concept drawing, and I'm sure that Mr. Mancini or Mary will correct me if I'm wrong on anything. And I would actually welcome them to get up and talk, because they've been waiting patiently for a couple hours. So.
Thank you.
Yes.
But as you can see, this is an overhead view. The top of the screen will be north generally, so just to orient you to the drawing. And the stuff that you see in what looks like clouds, the 3 cloud areas, are the improvements that we're going to do, and they're going to be what we call temporary kennels. And they're going to individualize space for each of the animals. That can be moved from inside to outside while the staff cleans. It'll improve efficiency and definitely improve the operation as they clean. So with that, I probably should let my 2 partners here talk a little bit so that it's at least worth their while. So.
Thank you, yes. Welcome, welcome. Mary, there's a mic right there also, and then there's a mic up here.
He's our expert.
Yeah, welcome.
Thank you.
Welcome, Mr. Mancini.
Good afternoon. Let's see. met with staff, went over the operation inside the facility and how they clean the area. And they were trying to do it in such a way to be able to move more animals outside, to be able to clean inside more efficiently, and also to have some daylight and being outdoor for the animals, very important. And also areas that could be controlled as play areas, and also areas that could be used for adoption. So the kennels are arranged around an open area, and the large one to the north has 2 large areas, and to the west of that area is where the present adoption area is. And also lower down, just outside the building, is another kind of a kennel area, you might say, but it's for cats. It's not identified, but it's a rectangle in the lower left there, and that's called a catio for the cats to get out. Not out of the area, but I mean,
Right,
sure,
right.
it's small inside.
Exactly.
Cages. Let's see. At the time, we weren't sure about the dollars that would be necessary, so the areas were divided up into different areas to see, you know, how the funding would go for it. And so we got quotations from different kennel companies, and one company has been decided upon. Mary?
Well, we've decided on Prefert. They're galvanized and powder coated, and they're also the best price. And they're very easy to work, to handle, to move, and to put together. So they will be really good.
So Mary, will these be permanent structures, or you said, or they'll?
Yeah, we can move them.
Okay, nice. So
You know, they will be anchored so
right.
that the dogs can't move them. But if we needed to move them, we can do
Okay.
that, as well as the catio.
Mm-hmm.
And then we're going to try to use some of the fencing that's already there between, between the areas where the dogs are. We might be able to move that into another area so that people will have more areas for pet testing.
Mm-hmm.
So we're trying to utilize that.
And you talked about, I don't know, who fundraising for this project? Or funding for the project?
Well, okay, thank you.
So currently we have a line item at the police department for donations for the shelter.
Mm-hmm.
And we've had some funding that we've had sitting in there for a while, just trying to decide what we're going to do with it. And a little background on this project, or just the work that we've done with the Humane Society. We've been talking about some sort of project that we can do to better improve the efficiency of operation and help out there, because it's really, those areas, they're wide open, but you can only put a couple animals out there at a time, and hopefully they get along with each other.
Yeah.
This adds to the efficiency, and it really helps out with the cleaning. I can speak to that because I went down to see what that was like one day, and it takes a long time for one person to do so. But to the fiscal note of it, it's going to be a partnership with the Humane Society, the PD, and the Finney County Sheriff's Office. The Finney County Sheriff's Office has donated $20,000 to this project. We have the line item that has the $17,532 for the donations, and then we have some funds left over for building repairs in the line item for the shelter that we're going to use to that. We're going to purchase the material, and then the Humane Society is going to help out with the cost of the installation and the labor that goes along with that through their fundraising.
A great partnership. That's really
Given the
nice.
partnership, and I appreciate the police department coming up with the strategy for the first 24,000, almost $25,000, and then I appreciate Chief's communication with the sheriff, and it's city-owned facility, but it was constructed in partnership with Finney County, and so I really appreciate the sheriff's contribution and the chief approaching him. That was sufficient to purchase the materials. It was within the spending authority, and since there was zero budgetary impact to what you had already approved, I guess in theory there's vulnerability that that line item may need to be used in the next 45 days, but if that should arise, we'll address it. This was a good opportunity to move forward with the work that had been done by the Humane Society so far. As Captain Pruitt mentioned, the improved efficiency for the folks that work down there is going to be a big deal. So that's good partnership, good project. I guess the point of this was to let you know we're doing it.
Right. Well, congratulations. Great project. Yeah.
But if you've got any questions of Mary or Vince or of the police department, we'd be happy to.
No, it looks good.
Yeah, Mary.
Actually,
Looks
very great improvement to the shelter.
Yeah. Wow.
Well,
Thank you so much.
We thank you very much. We thank the police department because we work with them. We thank Matt, we thank all of you. And Vince has been instrumental, so.
Yeah.
That's right.
He's our brainchild.
That's right, yeah.
Yes,
That's what
he
you
is
need.
good.
Yes.
Oh, that sounds great. Thank you so much
Thank
for
you very
sharing.
much.
Thank
job.
you.
Thank you for your
all, and
patience
thanks
also.
for your patience.
Oh, that was fine.
Yeah,
Thank
thanks for your patience.
Thank you.
You'll see some staff reports on the agenda under report of the city manager. Do you have any questions on any of those staff reports?
I just wanted to ask, I know in the municipal court building, how it's going. I know I saw a couple of dumpsters. Is it moving at the anticipated pace?
Yeah, I think Jennifer's across the hall, and so we'll wait for the 7 or 8 second delay, and then she can come back over here.
Can Chief or, well, I think Captain Pruitt can talk about it.
She's in her office.
Okay.
Oh, okay.
Well, maybe Captain Pruitt can give us.
Yeah, I mean, it doesn't
kind of
have to be a
start on
big
an
update. Yeah, I was just curious. I'm sorry.
I
Hello
can
again.
again,
Sure.
good afternoon. I can talk just a little bit about how the progress is going, and I'm sure Jennifer can speak to the overarching. I was there today. They've got quite a bit of the carpet removed, some of the walls removed, lots of help with all the different departments from the city. Lieutenant Oaks, E.J. Oaks, is kind of spearheading it from the PD side of the house, and we're using people that just want to help out and get a little bit of overtime to help do that. So it's a good partnership with us. Gets us interacting with some of the other departments. So
That's great.
Good.
So where we're at right now, when we met with Gibson, Mancini, Carmichael, and Nelson and walked through the plans and kind of where we were at, one of the things that they identified as a place for us to save some dollars would be to do as much of the demo ourselves as possible. So we had staff look through that and say, what do we feel like we're capable of doing? What do we not feel like we're capable of doing? And where does that fall within things? And so EJ Oaks and Randy Ralston are actually taking the lead on that together, and then EJ's actually handled most of the setup of the demo and who's going to help and how they're going to help and all that kind of stuff. Stuart did an amazing job of creating a diagram for us of exactly what was taken, what was being removed, what was being left. We did run into a very small portion of asbestos tile, and so currently that's all blocked off, and we are in the process of getting bids to have that removed. We did receive 3 bids, however, as we were doing demo, we ran into what we think maybe some more, so we just sectioned that off, and we're waiting to see about having that removed, but because we'll have to have each of those 3 companies come back and take a look at that. So that's kind of where we're at on that. I think it's going well. It is going slower than we thought it was going to go. A lot of that has to do with the fact that we did have bad weather last week, and so obviously the crews that clean up streets and that sort of thing, they were tied up doing that. The police department has been really busy, and so employees are tied up with that. We do. I talked to EJ last night, actually, about progress and where we're at, and he felt really good about the progress that we were making. So kind of next steps, we're in the process of working with the architect to create the bid documents for the contractor that will go out to try and solicit contractors to do the work on the building. And just kind of so you understand where we're coming from, we're looking at it from kind of two different options. So that if you were a really big contractor, let's say like Deck Construction or Lee Construction, someone like that who could do the entire project, you could bid, and you could bid on all of the different aspects. But they're also going to be broken up into each different type of work we're going to have done, from plumbing to electricians to floor, all of the different things that we're not doing ourselves. And then smaller contractors will be able to bid on those things. And then we can take a look and say, okay, does it make sense to go this route, or does it make sense to go this route? And how does that fit into our budget and what we're doing? Beyond that, I think everything's been going really good. I've really been thankful, in talking to the architect, reminding them of the budget that we're on, and, where we're trying to save and where we're trying to cut back. And it's just been really great. Tyler Patterson has also done a phenomenal job of being able to get in touch with people and get in touch with them quickly. And he's amazing at getting contractors to come to the building to talk to us and talk about the problems that we're having and kind of where we're going with things. And so he's been able to move that really quickly. And he's gotten really into the project. He's picking out paint colors and sending them to me. And this goes with this, and you should choose this. And I mean, he's just been a huge, huge asset to this project. So between him and EJ, and then some expertise from Mike, Mike's really been kind of a good sounding board for me to say, what do you think about this? How should we approach this? Here's the information I'm getting. And so it's going really well. I hope that, I was hoping that maybe by the November 17th meeting, we would have bid documents ready. I don't know if it's gonna happen on the November 17th meeting. I'm still pushing that will be the case, but we'll have to see how the next week and a half or so goes.
Thank you. No, I appreciate that.
And if you guys want to see it, I'm happy to get you over there to look at kind of where we're at. We are having Jamie document along the way as we go and take pictures. So she took the initial pictures before we did anything, and we'll have her take pictures throughout so that you guys have a really good picture of the journey that we took to go from one side all the way to the other. So.
Thank you, Jennifer.
Sounds
Yeah.
good.
No
Good
problem.
update. Thank you, guys. Just also wanted to mention on the sales tax, that looked really good again. I mean, it's,
Yeah, the
We're-
Sales
we're-
Tax Oversight Committee met, and they were really excited about that.
So we're definitely open for business. Come shopping.
Yeah, trending well.
Call your attention to meetings of note. And, just mention again that we'll add to those meetings of note the November 11th, 10 a.m. here at the City Administrative Center, special meeting of the City Commission. I think we're ready for the appropriation ordinance. If approved, it would be ordinance number 2518-2020A.
Mayor, I move to approve appropriation ordinance number 2518-2020A.
So we have a motion by Commissioner Orla. Do we have a second?
I'll second.
Second by Commissioner Cessna. Any further discussion? All those in favor say aye.
Aye.
Aye. Opposed, same sign. Motion carries.
Item 10A, the governing body is asked to consider and approve an amendment to the Garden City zoning regulations, section 10.050, zero lot residential overlay district. If approved, this would be ordinance number 2883-2020. Carol?
Good afternoon. Wait a little bit longer, I could say good evening. But Matt, could you pull up the image I have? It's in the report. I think it's the diagram, the zero lot line. There it is. Okay, it's easier to show a picture and talk about the picture while I'm explaining this. This application request came from Corey Hodap, who is the person that is developing Prairie View Acres. They have a section in their subdivision that they have rezoned to zero lot line, which means it's not like a condo where you have everything that's on the lot line. It's one house is on the lot line, and then the house that's next to it on this, you can see on this diagram, it's pushed over and it's on its lot line, and then it just kind of continues down. In our regulations right now, we do not allow windows or doors or any other kind of opening on that side that's on the lot line. And he actually made up some floor plans to follow that regulation. However, they got down to the end of the row and they did have some utilities that were in the way, and so they kind of had to flip-flop the house, and then they ran into a problem with having to have windows on that side. So he did ask for this amendment. I am the one that did the research on this one. I did do research quite a few jurisdictions. I could not find another jurisdiction that had this regulation. Talked to a few people, and most of them just basically have, an easement for repairing things, fixing things for the homeowner that lives on the other lot, which we already do have in our regulations. The only thing I could think of was maybe fire reasons, because your fire rating will go up if that house on that lot too, if they built right up against, 2 feet away, then they'd have to have some fire rating going on. But already in our zero lot line regulations, we require a 10-foot separation. So I didn't really see an issue. The applicant has asked just to remove windows. So still not allowing doors or other openings, but allowing windows. And so we did not see a problem with this. Staff did recommend approval of this. We did bring this to the Planning Commission. We did have a full house. All 9 of them did recommend approval of this amendment. I can answer any questions if you have any. Your choice is to either approve or not approve or table.
Any questions for Carol? If not, I'll call for a motion.
I move that we approve ordinance number 2883-2020.
So it's been moved by Commissioner Dick. Do we have a second?
I'll second.
Seconded by Commissioner Ortiz. Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries 5-0.
Very
Thank
good.
you.
Thank you.
Thanks, Carol.
Item 12A, under new business, the governing body is asked to consider and approve task order number 4 between the City of Garden City and HNTB for the architectural and engineering services for the design of a new terminal facility at Garden City Regional Airport. Rochelle?
Good afternoon. Before you, like Matt indicated, is a task order for the design of the new airport terminal. The task order total amount, sorry, I'm a little out of breath from trying to go here. The total amount of the task order is $1,789,925. Of that, the FAA will pay $1,190,300, and the city pays $599,625. The city's portion of that funding will come from the Kansas Affordable Airfares program funding that we have. So that'll be an expense that comes out that's already budgeted in the airport terminal fund. The design will incorporate basically doubling the size of our current terminal. It'll be a phased project with construction pretty much demoing the restaurant, and then headed to the north would be the first phase, and then the second phase would be the current terminal building. The programming was all designed and discussed in 2018 in the terminal area plan, which is one of the attachments that you have for additional information. The FAA also requires an independent analysis of the fees to make sure that it is reasonable, and that is also provided from BNIM out of Kansas City. The total project for the construction and design of the terminal is $26 million. We did receive a large CARES Act grant in the amount of $17.9 million. We also have $1 million in the Kansas Affordable Airfares program, as well as there will be additional FAA funds and city funds that will be dedicated to this project, and those will be identified later as we continue through the design process.
That sounds great. Any questions?
I make a motion we approve task order number 4 as presented.
Okay, it's been moved. It's a long one. It's been moved by Commissioner Cessna. Do we have a second?
I'll second.
Seconded by Commissioner Euler. Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Thank you, Rochelle.
Thank you.
Find a picture. Like 800 pages.
Yeah, with the terminals now. They're not in there. Yep.
That's cool.
Yeah. Okay, well, the picture's really cool.
Yeah.
So look forward, I'm sure we'll be putting it out on social media and everywhere else. Item 12C, the governing body is asked to consider and approve, oh, no, I'm sorry, 12B. The governing body is asked to review a draft interlocal agreement between the City of Garden City and Garden City Recreation Commission for the delivery of recreation programming and administrative services, and to provide direction in advance of the Garden City Recreation Commission and the City of Garden City formally considering a consolidation of parks and recreation services at each agency's next meeting, which we would anticipate would be a special meeting of the Garden City Recreation Commission on Monday, November 16th, and then our regular meeting on Tuesday, November 17th. At our October 20th meeting, staff announced the hiring of Aaron Stewart, who is currently the Garden City Recreation Commission Superintendent, hiring him to take on a senior management position previously held by Public Works Director Sam Curran. This offered us an opportunity to realign department groupings and to explore the interest in and logistics of dissolving the Garden City Recreation Commission as a unit of government, and then creating a city parks and recreation department. Much work has gone into reviewing the legal process by which the dissolution would happen. Early on, it was identified that dissolution would take at least 6 months to a year, and a draft interlocal agreement between the two agencies was developed to take advantage of the window created by the city hiring Mr. Stewart. It's since been determined that because of statutory requirements on the dissolution process and implications of a full consolidation on the city's status under the current tax lid statutes, that an interlocal agreement for contracted services may be the best way to structure a functional consolidation until such time as the state legislature could consider special legislation that would provide more clarity in how to appropriately dissolve Garden City Recreation Commission, as well as special legislation that would protect the city against being adversely impacted under the state tax lid. At their October 26th meeting, Garden City Recreation Commission reviewed a first draft of the interlocal agreement. Comments and concerns were gathered and incorporated into a second draft, which is attached on this agenda item. Staff requests that you review this document, which I'm sure you have, and provide today comments, concerns, and direction as to your interest in moving forward during this meeting. If the consensus is to continue moving forward, staff requests the commission identify a commissioner to participate in a working group that also includes a GCRC board member, attorneys from both agencies, myself, and Aaron Stewart. This group will continue to work on the draft interlocal agreement over the next 2 weeks in preparation for final consideration by both agencies. The group will also be reviewing recommendations around the logistics of transitioning all GCRC employees to city employees, and as also the assignment of assets. So today, there's really no action necessary, although you could. What we're looking for is consensus that you're still on board and would like us to move forward. You can do that either in the absence of saying stop, or if you would feel more comfortable taking a vote that to move forward, whatever expression you think is most appropriate to say keep moving forward towards this goal of November 16th and 17th, both agencies taking up the matter. So I think Randy's been the primary legal staff working on this document. I don't know the extent to which, Jimmy, he's prepped you, but I believe that I could log some questions you have that would be more of a legal nature. If they're, how are you guys gonna do this procedurally? I can speak to that as well. Aaron's also here and can speak to the rec side of things. I know he's his board. He's sent this draft out, or they've seen it obviously as part of our public agenda packet, and I think have provided some additional questions that their council's looking into. So, there's not a playbook for this. seems to be the theme of the day. And, I think the intent's really good. We knew there was going to be some issues we'd have to work through in the detail. But I think maybe I like this version right now best, because what if we get into this and it wasn't the best thing? It would be more easily, we'd be more easily able to transition back to sort of the way things were. So, Aaron, did you want to present anything or just field questions?
Just if any questions, I'll be happy to answer those. I think you laid it out pretty well where we're at.
I think, I just have one question as far as just umpires and stuff. I know we contract those through the rec. Is that still going to be handled the same way as far as?
It's going to be call your own fouls.
Okay. Parent decisions?
Yeah, parents are going to call the fouls from the stands, and youth and adults are going to be call your own fouls.
Sounds like you're volunteering.
Yeah, no, that's exactly what I don't want to do.
I do have a question. So will the Rec Commission continue to set their own mills? I mean, or will they set their maximum mills, or how will they do that? And then just making sure that I know you preserve some mills for your health insurance program. Will that go away? I'm curious about just the workings on that.
So under the current agreement in front of you, they would levy at the current max mills that the city commission originally set for them, which is 5 mills for general operations, 1.5 mills for employee benefit, unless otherwise mutually agreed upon, i.e. we figure out we only need 1.3 mills to run the employee benefit. We would then, just like we do now. That's what
so you'll keep your own employee benefit, or you'll come into the city's, or you'll come into the city's health benefits?
The employees would go under the city's health plan.
And then you'll just pay us pay the city for?
That being a funding arm of that plan.
Okay, that's what I was trying to figure out.
All of the employees, well, first, I couldn't pass up the joke, sorry. Commissioner Ortiz's question on umpires, and then can you answer?
So
can you answer that?
I think
first?
some of that is we'll work with the city's process on how to hire contract officials and staff, because it's not just officials. It would be fitness instructors, personal trainers, things like that. So we would move to that process of hiring out contracted, what would be in essence seasonal personnel. So there could be certain changes to that, but ideally looking at it from the high level right now, we would basically do that the same in regards to what matches with city policy.
Okay, so the seasonal would then, they'd be on payroll for the city and as part-time or seasonal?
For seasonal employees, yes, they do have some officials that are contract that don't fill out, that don't become employees, that are private contractors. And so in both of those instances, that relationship would be with the city of Garden City, as will all their employees as they transfer from being Garden City Recreation Commission employees to City of Garden City employees. This interlocal agreement has the government still in place, the Garden City Recreation Commission, but they are contracting with the City of Garden City to provide all their programming services.
Right.
And so their employees are ours, and then the contract is with the City of Garden City to deliver recreation programming services. The parks, for all the facilities, and certainly all of the grass right now, but in the end, be grass plus buildings. The maintenance of the property and the care of the property would be with the City of Garden City, utilizing again our staff and the expanded staff by taking on the existing Recreation Commission employees that do maintenance. So we would be doing that. Your question on employee benefits, but I'm going to take both sets of that. We are going to separately account for Recreation Commission expenses. So this isn't just going to flow into the general fund of the city. These will be treated very much as enterprise funds with no tax levy.
That's why I was curious.
And that money will stay in that. The discussion we had with the Recreation Commission Board, our interest in doing that isn't to find a backdoor way for money to get into the general fund. This is the community's levying these funds for recreation services, And every one of those dollars needs to be accountable towards recreation services, and so we want to set things up that way. I can't get more detailed than that. Probably we need to have Melinda walk in the room and tell you exactly how we do that, but even those employee benefits for those folks that are involved in recreation programming and services, those employee benefit dollars would be accountable for, and you'd be able to identify and attribute that to those employees actually doing that, rather than law enforcement or fire protection or something of that nature.
So Matt, will they do their own payroll, or will payroll all generate out of the city? Okay.
There won't be I mean, there's going to be 5 board members, and they'll probably have some funds to hire some legal counsel, because our counsel can't represent them. They're,
exactly.
The other side of the party of the agreement, but there won't be a they beyond that. I mean, it's, their employees will be our employees by contract.
So we're taking over like lease agreements and everything else, I understand it, in this agreement, right?
Yes.
And our legal counsel's okay on all of that, okay.
Yeah.
So we're talking about the core and also the new Albright Gymnastics Center?
Correct. Yeah, I can't remember the comprehensive list of leases for property, and there's some other leases too for some capital equipment, but all agreements, all of those things are assigned to the City of Garden City. I believe we've checked all of those, and some of them there has to be a consent to assign, and we've received that from all the other parties that that's an acceptable way. And it's going to be attractive for somebody to say yes to having that assigned to us. I mean, just from a risk management standpoint, they've got a larger pool of money to draw down on if something would go bad. So it would be in their best interest to have that assigned to us.
Any other questions or comments? So I know that by consensus, so I'm checking for consensus. Are we willing to move forward?
Yes.
So I'm seeing everybody's head shake.
So
Now,
I'm sorry, there was another issue that I think was brought up that probably hasn't been resolved in this draft. Do you remember what that was, Aaron, and is it worth throwing out there just so the commission, the city commission knows what that one was and can think about it over the next couple of weeks?
I mean, the EBF fund, the
employee benefits fund, how are we going to separately account for that? Yeah, we can definitely solve that problem.
Yeah. Other than that, I think it was some small language changes, and then, the legal questions surrounding as far as, filing, auditing, and some minor details that are more in the weeds. So.
Yep.
Okay. All right.
So I know that there's, so we have the consensus, we're going to move forward. I'm curious about, and then I want to offer it to first Commissioner Euler. I know you've worked with that, but if that's something that you feel a conflict of interest, because I know you're really close and have a working knowledge of that, but if you don't have the time or you would rather not, we'll check with other commissioners.
Well, I know that it's something that they want to get done in the next couple of weeks, and with me being gone for a good chunk of that, I mean, if you can work around that, that's fine, but, I mean.
Okay, without that, Commissioner Sessom, would you, I'm like you. I'll go ahead and I'll disappoint myself. I'll go ahead and, well, that way we don't, I'll go ahead and appoint myself to work on that working group, so we'll take care of that. I mean, I think it's an awesome idea. So does Aaron work this city, or he's working, I know he works for both, so who's his boss?
I don't think he knows at this
Does he have a bunch of bosses? I'm curious. Or is everyone his boss other than Jamie? So I'm
Currently, at this time, I'm still employed by the Garden City Recreation.
Oh, so we can really, all right, that's good.
And he's been generous, and I believe in letting us play this a little bit by ear. Certainly, I think he and I both think that this window of opportunity is kind of worthy of taking our time on the other piece. So, and they need him at the same time we transition the rest of them. But that could change next week if we find a good reason to change it. But we had a good meeting, I think. I didn't stay around for the whole thing, but we had a good meeting with the Recreation Commission staff, myself, and Human Resources Director Ali Medina. You know, there's you know, several employees, full-time employees that you know didn't ask for this. It's just happening, and so we wanted to make sure to take the time to answer questions they have. It's our intent to treat them as transition them, you know, in at least a hold harmless kind of way. But we think there's even some added benefit, maybe, especially when you look over the long term. Their start date for the City of Garden City will go down as the start date for the Recreation Commission. There are some benefits that are related to longevity, and so we didn't want that to be a punitive thing to them.
That's nice.
And when we're finding kind of, I think, the way they would prefer to see their health insurance coverage transition. What else? The implementation of the new pay plan on January 1st is we've taken that into consideration. Plugging them into the pay plan, you know, their titles now, some of them, especially, you know, it's so much in the maintenance side of things, but the recreation programming, we don't have anything in our pay plan that speaks to that. Right. So finding where those are at and letting a third party assess that. So McGrath has handled that for us to say this is where that would plug in. So trying to make sure we do right by their employees as we go through this process.
Oh, you have an incredible, well, since you work for the Rec Commission, you have an incredible board, and they've been very, very active and very, you know, innovative, I guess is the word I want to use. So really appreciate all that you've done currently as the Rec Commission, and so we're looking forward to this new partnership. So.
Yeah, I agree. It's been a pleasure to work with them for the past 4 years, and I know we've had some components change, but it's always been pretty consistent. And the other thing I'd say is, you know, the spirit of this agreement is to consolidate, create efficiencies in order to find opportunities to improve the current parks and recreation systems in town. So I think that's very exciting. I think that does accomplish the goal of both entities if we can make that happen.
Thank you.
I'm glad to have you for the next 40 years.
Yeah.
Or more, I don't know how old you are.
You just thought you're getting away.
I'm too old for 40.
Yeah, item 12C, and thank you for your input on that, by the way. We'll look forward to bringing that back. Item 12C, the governing body is asked to consider and approve an application for the Kansas Emergency Solutions Grant through the Kansas Housing Resource Corporation. Melissa.
Afternoon, Mayor and Commissioners.
Afternoon.
Hello. We bring before you a request to apply for the Emergency Solutions Grant. In July, we brought forth a request to accept funds for Emergency Solutions Grant. However, as time passed, we were informed that these were part of the Kansas Housing Resource Corporation funds as part of the CARES Act. And so we went ahead and accepted the $95,760,000 on behalf of Catholic Charities of Southwest Kansas and Family Crisis Service Center. We were notified at the beginning of September that there would be additional funds for ESG this year, and so that's the application that we're bringing before you on behalf of Catholic Charities of Southwest Kansas and Family Crisis Health Center. We are looking to request $64,180,000 in funds. And the ESG program, is just a reminder, is designed to identify sheltered and unsheltered homeless persons, those at risks of homelessness, and provide the services necessary to help those persons quickly regain stability in permanent housing after experiencing a housing crisis or homelessness. We did administer this grant in the 2019-2020 grant cycle and was awarded $52,461. And we've been able to administer the grant as part of our staff duties in the last 2 grant cycles, and we are willing to continue to administer both grants moving forward. We do receive 2.5% of the ESG awarded funds to cover those administrative costs, and we would receive that into our budget. The administrative costs as a fiscal note are provided to assist with the grant, and the alternatives before you are you may approve the application on behalf of Catholic Charities of Southwest Kansas and Family Crisis, or you may not approve the attached application. Staff recommends alternative 1 to approve the application for the Kansas Emergency Solutions Grant
on behalf of Catholic Charities of Southwest Kansas and Family Crisis Center. And Marcy Smith has been a trooper.
Hey, Marcy. Thank you so much. Thank you for your work.
If she has anything to say, please give her a minute.
Sure. You have to come up to the mic, please, Marcy.
I'm really just here if you had any questions about it.
So Marcy, my only question is this still a competitive grant, or is it a grant that if you apply, you get awarded, or?
This one is competitive. The one
Okay.
we received in July was awarded to us because of our previous grant.
Okay, great. Okay. It's only clarification. Do we have a motion?
Yeah, I move to approve the application for the Kansas Emergency Solutions Grant on behalf of Catholic Charities of Southwest Kansas and the Family Crisis Center.
So we have a motion. Do we have a second?
I'll second.
So seconded by Commissioner Dick. Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Thank you so much.
Thank
Thanks,
you,
Marcy.
guys.
Thank you for waiting. Yeah.
You get your civic merit badge
Yeah.
today. Item 12D, the governing body is asked to consider and approve hourly rates charged to local businesses or other entities for the hiring of sworn personnel from the Garden City Police Department to conduct extra duty security. And I'll invite the police department down to visit about this issue. Oh, here, you're already here.
Good afternoon,
Like a
Mr.
ninja.
Mayor, City Council.
Good afternoon, Officer Hurley.
Appreciate you guys letting me talk in front of you today. Some of the things that we've been dealing with lately is that as the city continues to grow, some of the businesses have reached out to us for continuing to provide law enforcement security for those special events that have not been able to been provided for by on-duty personnel. And in order to continue to strive to provide effective police services to the community, we're asking the governing body to implement, allow to contract with these businesses through the city, pay the city, and then that would then pay the officer at their overtime rate for these services. The current procedure right now is that an officer conducting off-duty security for secondary employment in uniform requires for the business to sign an agreement through the city. The business pays the city $30 an hour for the use of the officer and their equipment, including vehicle. The city then reimburses the officer that their overtime rate to include all their benefits, workers' compensation, KPNF, and et cetera. This can be more or less, and usually is less than what is spent by the city that is recouped. So we are also looking at the gross pay for the officer may be more or less than the $30, like I stated, I'm sorry. And currently these funds come out of the GCPD budget, which are then reimbursed back into the general fund. If the event requires a command level officer to work the event, then the contract agreement will then charge $60 an hour instead of the current 30. So we're asking an increase to 50 for officers, 60 for command. This would be on a case-by-case basis determined by the chief of police on those instances. Command officers would be then compensated at their hourly rate to help offset their benefits and what the city needs to pay for these officers to attend. We've been in contacts with Mr. Dummermuth and Ms. Cunningham, as well as Christy Rojas as well at payroll, make sure all these things can happen and are lined out for City Commission to review. The regulation and agreement that has been submitted to HR and to City Council and to Mr. Grizel's office were reviewed, and the changes were made to help us meet any legal requirements that might come out as a result of this issue. Currently, officers that are paid at an overtime, currently at the entry-level rate of $16.50 an hour, which is our entry level currently until January, which I'll cover that shortly, will be paid at an overtime rate of $24.75. But an officer who is paid at $28.96 an hour, which is the highest level, will receive $43.44 an hour. So that is obviously exceeding our current reimbursement of $30 an hour. That $30 an hour is a number that has been around for over a decade, and we are just trying to make it come in line with current costs that we are experiencing. As of January 2021, the city will be compensated at $50 an hour, so that that the overtime rates of officers would change to $31.62 for officers receiving entry-level pay and $46.11 for officers at the highest pay level. So to help offset that $50 new mark will help us offset the costs that the city is currently bearing and not recouping. If an officer is engaged in extra duty or off-duty assignment, takes action, the officer is now considered on duty. So the officer is now considered on duty and would be taking any police action. Having these policies and agreements in line would help us alleviate any legal issues from an arrest or use of force that might result from that incident. After-school activities, various events like dances from the high school and other nonprofits would not be lumped into this policy and procedure. Those non-for-profits won't change, the school won't change. None of that will change. Alternatives, obviously, the approval or implementation of our regulation and the agreement for handling extra duty and secondary employments officers. This policy will have all extra duty assignments monitored by the police department and paid through the city via contract between the city and the business. The officers would be paid at their overtime rate. So no matter what the city, the $50, if the officer's at entry level, will still recoup some sort of expense for the officer's time and their equipment and vehicle. The other alternative is to reject the proposal for handling and do not change the operating procedure of handling off-duty or secondary employment. Our recommendation from the staff is alternative one, obviously, of approving and implementing the regulation and allowing the agreement for handling extra duty and secondary employment by the officers. One fiscal note is that all payments received from the businesses will be deposited and reimbursed into the expense account, which is labeled in your packet as well.
So Officer Hurley, I have some questions. Does anyone else have any questions before we? I do appreciate on the document, page 6, of the things that you are not going to be doing, where it talks about bartending, bouncer, and all those kind of things. So I really appreciate that. So how does the process work now? So right now, then the request will be made to the police department, and then they'll be offered to people who are available, or how are they going to assign those requests?
So currently, right now, I'm technically assigned as that coordinator liaison for the businesses. There will be one officer assigned to that position currently. If the staff changes or something needs to address, we'll go from there. But right now, currently, businesses reach out to me. I then send out an email. We now have a new staffing software, which we'll be putting that on there, like Walmart. Black Friday's coming up. It's the big one. And that's what we're currently addressing, is the needs for that. Because of COVID, they have different events for different Black Fridays instead of just one big day. We then allow officers to sign up based on their day off or whatever, and they can sign up for the hours they so deem they want to work. Also, the policy, as you read, will also alleviate us from saying, hey, listen, we will have officers here. It gives us that out where it says, as we can provide. Obviously, the law enforcement to the city itself is a priority, and that's where it comes first. This is obviously secondary, and that's why it's called extra duty. So I hope that answered your question.
No, that did, and because so you'll always be in uniform, and you'll always be using, official police vehicles in those. So
most of the time, on a case-by-case basis, there might be a situation which would require us to be in plain clothes.
Okay.
But that would be deemed and approved by the staff, but command staff or the chief.
I appreciate that. Thank you. Any other questions? If not, do we have a motion?
I'll make a motion. We approve the agreement as presented.
So we have a motion. Do we have a second?
A second.
It's been seconded by Commissioner Dick. Any further discussion? If not, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you for all the background information on this. It was really well done. So
Thank you, guys.
Thank you.
Good job.
With that, we are moving down to the consent agenda.
Mayor, I move to approve the consent agenda.
So we have one item under the consent agenda. It's been moved. Do we have
I'll
a
second.
seconded by Commissioner Cessna? Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Okay, we're ready for, anything else, Matt, that we need to do in the new business before we?
We're ready for commissioner reports. Thank you.
Wow. Well, first of all, it has been a very long meeting today, but I have just really enjoyed the civil discourse that took place today. Having that many hours of public comment is unprecedented, and it was encouraging to see both sides presented and make good arguments and still remain civil about their positions. And I just think that's one of the things that I have enjoyed at today's meeting, and I would just encourage that to happen a lot more. I mean, this is how we know what to do, is when people tell us, and that's why we're elected. And I just think that was just something that was great today. I just want to also encourage people to get out and vote. And I also wanted to thank the street department during last week's ice and rain and snow and everything else for taking care of it as quickly as they did. So thank you for that.
Thank you, Commissioner Euler. Okay, with that, Commissioner Dick.
Great. Same thing, like Commissioner Euler said, I thank everybody who came out and gave us their thoughts on everything, not just a mask ordinance, but everything today. It's good to have engagement with the public, and that's, like Commissioner Euler said, that's how we do this sort of thing. Also, you did, like you said, we have very little time left to go vote, but make sure you go vote if you have not.
That's right.
A good presentation by Fred I was going to say this morning, but earlier today on the water and the water use of Garden City and the steps that we were taking to conserve that water and best use it for our community. That's great to see. Good job with the Humane Society. I don't know if you pay attention to their Facebook page, but if you don't want a dog or a cat, don't follow their Facebook page, because they put out so many good things.
Yep.
Also with the airport, there's a market study that was included with that airport. That's a really good read. For me, it's a really good read because I like numbers and data and stuff like that. But it was really well done. That was good to see, and good job to whoever put that together. Just a reminder that the banner art auction is going to be coming up, and it's virtual. November 7th. So you can go in and actually pre-bid on some of those banners. So make sure you do that, because that is one of the larger fundraising events for the Downtown Vision. And then finally, this is the thing I was trying to remember what I was going to say. Because we are getting into Christmas season, remember to buy local. I don't know, I don't do any of the reffing and all that stuff, but I don't think Amazon sponsored any of our local youth teams or the school, but our local businesses, offices, like that, they do support our local community. So when you have the ability to, please remember to buy local for this Christmas season. Thank you.
Thank you, Commissioner Dick. Commissioner Cessna.
Yes, I'd like to echo the same sentiments as the other commissioners on thanking everyone for their input today on, an issue that does affect our community, and that input, and from everyone else that I got input from as well, that does help us make our decision, and we definitely need that in making decisions for our community. Again, like Commissioner Dick was saying, sales tax is great. Our community's open for business, and we hope to continue to stay open for business and see how our sales tax continues to increase over the next coming months and the next coming years. And my final word is please go out and make your voice heard and vote. It's very important that you do that. It's part of our civic duty as citizens. It affects, how we are governed locally, but as well as nationally. So again, make your voice heard. And, today is the day to go vote. Thank you.
Thank you, Commissioner Cessna. Commissioner Ortiz.
All right. So you guys covered everything I had on the list. I would like to just say thanks to especially the water department for coming and presenting this morning. They had a wonderful slide that they showed us, and it was very interesting on seeing how we add up in the past 6 years. So I also like to say thanks to Neighborhood and Development and Services Department. There again, I'd just like to stress that if you are a new business coming to town, talk to that department. They know what they're doing. They're willing to work with you. They just love the opportunity to have your new business here in town, and so do we. We appreciate you looking into Garden City. So all of the information coming in today, we heard every one of you, not one-sided or the other. I'd like to say that our city commission gets along with our county commissioners, also gets along with Holcomb and the surrounding communities as well, Liberal, Dodge, Scott City. So I do believe that we would do our best for those citizens who voted for us here to be up here to make those tough decisions. So as we become leaders in the community, I just encourage you, the citizens, that we will do our due diligence on giving you the best option that we have with gathering all your information and then making your voice heard through us. So I'd like to thank all those people who came today, doctors, nurses, citizens, business owners. So it's going to be tough, but I think we can, as leaders, get through this. So thank you.
So I know mine is the last report between getting out of a very long meeting. So I do want to say thank you to the two business owners who came and made presentations earlier. I love innovation. I love seeing things happen in Garden City, and so Kansas Avenue is an important artery in our community, and I think both of these are viable options. So I'm looking forward to making that decision. Also, while we're talking about Kansas Avenue, I had some friends in from out of town. They walked the Tommy Austin Arboretum. Loved it. They wish there was parking, near there, but I said that's not going to happen. They did suggest down in front of, on Belmont, farther down where all that grass and the trees are, they said, well, this mulch looks so nice, why don't you just do that there? So I thought, well, I would pass that idea along. There are 2 exercise opportunities. So I know that part of staying healthy is exercise, eating, and getting lots of sleep. There's a Thanksgiving run coming up, so I'll see y'all out there. And then the Jingle Bell Run, the Rec Commission, that's always a lot of fun. I mean, depending on how cold the weather is. Sometimes running in the cold is not fun. I do want to say thank you, especially to all of those who patiently waited, were kind and respectful, were willing to make their voices heard. They were extremely articulate. I was really blown away by not only what they said, but also that their willingness to really present their ideas in a manner that we could actually listen and hear. And that doesn't sometimes happen. Sometimes that the volume and the rhetoric overshadows what they really want to say. And so I think everyone did a great job. I've also received lots of phone calls and emails, and a new one for me is Messenger. I'm learning that you can actually people can get to you on Messenger. So I'm working through that. I'm a little bit slower at that, but I do appreciate all of the outreach. And so that's really meaningful. I did want to tell you that I was able to take part in a phone call from the Tyson plant's new manager, Dennis Jones. Tony has moved on, and so Dennis has moved into that position. He talked about all the different things that they're doing. One of the things I think was so exciting, and I think really came across when Matt and I were able to talk Zoom call with him. He talked about a We Care program, which has made all the difference. It's a competitive business, bringing people into work in the plant. But they said if they can get them into the plant, they'll be able to keep them. They really care about their people. They are also doing a new off-site health opportunity, so a health clinic, and I think much like we have here with Grow Well. But their We Care program, they said, has just been really a way to really reach out and make all the difference in their people's lives. And the things they do through that We Care program are amazing. I mean, not only classes, but there's many other things that they do to really benefit their employees, to keep them here in our community. So they are very vital workers. With that, I'm excited about today. I know we have our special meeting. Make sure if you'll see another invite, Seelan, that's so useful. Just on that, and then only because I need that kind of, that reminder. So with that, we will call today's meeting adjourned. Thank you so much.
Thank you.